1, live.
Good morning. Just to let people know, we had a couple of technical issues last night accessing our board book, so we are starting a little bit late. So I just want to recognize that, and I want to thank the tech team, and I want to thank everybody else who helped us scramble to make sure that we had everything in order for this morning's meeting. Recognizing a quorum of commissioners, I call the October 9th, 2025 meeting of the Cannabis Control Commission to order. This meeting is being held hybrid pursuant to Chapter 2 of the Acts of 2025 and is being recorded. Commissioner Stebbins, Roy, and myself are all participating in today's meeting. All votes taken today will be by roll call. We have a full agenda today that I will generally summarize. We will start with opening comments from commissioners, then the appointment of the acting secretary, followed by meeting minutes. Then executive director will present the executive director and commission staff report before we proceed to staff license recommendations. There are 2 changes of ownership recommendations, 31 license renewal recommendations, 2 staff updates on expired conditions on license renewals, 2 provisional license recommendations, 2 final license recommendations, 1 responsible vendor training license, 3 responsible vendor training renewals, and 1 hearing officer recommended decision. There are 5 items in the commission discussion and vote section today: license extensions for host community agreement and compliance, delegation of petitions for changes to regulations, 8th annual activities report, general matters, legal billing, and standing delegation of acting chair. We anticipate taking a 30-minute lunch break at noon. I will ask commissioners wishing to comment or ask questions during any part of the meeting to raise your hand to be recognized. So to begin that with those comments, my comments are, I'm happy to have everybody here. Let's get to work, and I will turn it over to Commissioner Stebbins. I think you should start. Commissioner Stebbins.
Okay. Thank you, Chair. Just 3 quick items since we last met. Want to thank the City of Somerville. They included us in one of their virtual public meetings. It was held on Monday night with potential social consumption license applicants. It was the 2nd of such outreach for the city with potential applicants. Somerville is going to be holding 3 other sessions with local residents to get their input. We hope to have the opportunity to listen into those discussions as well going forward. Secondly, I want to offer my congrats to our Chief of I&E, Noam Khaleesi-Jones, being awarded the Paul Cellucci Award for Leadership and Mentoring in State Government. I had the privilege of working with Paul Cellucci in his days as the state senator and all the way up through his service as governor. Certainly think that Chief Jones embodies the commitment to public service that he valued. It's important to note that I think the governor approves all of those final selection decisions. So congratulations to Chief Jones. And finally, took the opportunity to listen into one of the scheduled virtual SEP training sessions last Thursday with respect to HCAs. Good session, good participation, and hope to have a chance to listen into the others as they get put on the calendar. That's it.
Thank you. I did not know of that, but certainly served at the State House with the late Governor Cellucci, whom I considered a political opponent, but a friend. So he was a wonderful person, and I'm pleased that Chief Jones received that recognition. Commissioner Roy.
Thank you, Madam Chair. I want to congratulate Chief Jones as well. That's a credible recognition of her leadership here and her work here. And, obviously she holds a very important role, very integral part of the industry. So again, congratulations, Chief Jones. I will echo the chair. Let's just get to work. Thanks.
Okay. So the first vote that we will take is the appointment of the acting secretary. And I will accept nominations. I believe Commissioner Stebbins is ready to step back into that role temporarily. Still, oops, sorry, echo here. Okay, that Commissioner Stebbins is willing to step into that role. Do I hear a nomination to appoint an acting secretary of the commission? I'm sorry, I thought I said Stebbins. Sorry, Commissioner. I'm accepting a nomination of Commissioner Stebbins to be the acting secretary of the commission. Do I?
More than happy to nominate Commissioner Stebbins as acting secretary. So.
And I second that. Would you like to make an acceptance speech?
I'm good.
The vote.
Okay, no, I'm just saying, we might change our minds,
I'll
but
save
anyway.
everyone the trouble.
All right, hearing that moved and seconded, I'll take a call of the roll. The chair votes aye. Commissioner Roy? Aye. Commissioner Stebbins?
I'll vote aye as well.
It is unanimous. Thank you very much. And then we were moving on to the minutes for approval. We have, and again, this is, I'm just trying to make sure, General Counsel Chattopadhyay, I just want to make sure, can I take all of these minutes as a group and just take one vote, or do I have to vote on them individually?
Thank you, Madam Chair, if I may. The better practice is to do them one at a time.
Okay,
I would recommend.
great, we'll do
One
that.
at a time.
Okay, so I will accept a motion to approve the July 10th, 2025 meeting minutes. Commissioner Stebbins, do I hear a motion?
So moved.
Do I hear a second to that motion?
Second.
Having been moved and seconded, I'll take a call of the roll. Chair votes aye. Commissioner Stebbins?
Aye.
Commissioner Roy?
Aye.
The minutes are unanimously approved for July 10th, 2025. Motion to approve the July 28th, 2025 meeting minutes. Do I hear a motion to approve those minutes, Commissioner Roy?
So moved.
Do I hear a second, Commissioner
Second.
Stebbins? Moved and seconded. We'll take a call of the roll. Commissioner, Chair votes aye. Commissioner Roy? Commissioner Stebbins?
Aye.
It is adopted unanimously. Move on to motion to approve the July 29th, 2025 meeting minutes. Commissioner Stebbins, will you move to accept that motion?
So moved.
Do I hear a second? Commissioner, moved and seconded. Chair votes aye. Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
It is approved unanimously. Motion to approve the August 14th, 2025 meeting minutes. Commissioner Roy, do I hear a motion to approve the August 14th, 2025 minutes? Commissioner Stebbins, do I hear a second?
Second.
Moved in second. Chair votes aye. Commissioner Stebbins?
Aye.
Commissioner Roy? It is approved unanimously. We will now move on to the Executive Director and Commission Staff Report. We'll turn that over to Executive Director Travis Ahern.
Thank you, Madam Chair. If we could have the next slide, please. Next slide as well. Thank you very much. So these are the specific items that are listed on the agenda. I'm going to cover a couple miscellaneous things before that. If we could go to the next slide. Thank you very much. And so for the items listed here, happy to discuss any of them, but also just general updates. Noting that the survey is part of the ongoing report that is coming back to the commissioners in January for the delivery exclusivity. The discussion, it has a survey involved, which is closing tomorrow. It is specific for licensees within that field. Those licensees have been reached out to. They have been sent a reminder this week and also posted on social media. That is closing tomorrow, October 10th.
Excuse me, Director, can you just, what is the universe that is getting this survey? Which, can you just describe to me? I think I know, but can you just tell me who that is?
Certainly. So I think obviously some of the questions are specific for delivery licensees, as well as the universe being those in the SEPEE program.
But my point is, are we surveying all the people who've gone through the program, or just the people that are either in the queue or are licensed or commenced operation?
The survey is more broad than just specifically delivery licensees within the program.
Okay, thank you. Go ahead. Thank you. Sorry for interrupting. Commissioner Ray, you have a question?
Mr. Executive Director, will we get the feedback synthesized and
Yes.
share with us?
Yes, so that will be within obviously the report as well. That is one of the elements that our team is doing in conjunction with UMass Donahue Institute to split the work. And so that will all be included.
Commissioner Stebbins, do you have any questions, comments? No?
All set.
All right, moving back to the Executive Director.
And I just point out as well, since obviously these are team efforts, the research team, the data team, and the Deputy General Counsel have put a significant amount of work into this, and we are on track for coming back to you in January.
Thank you.
Equitable relief request, I just wanted to acknowledge.
Commissioner Roy?
The working group, is it still meeting regularly? And okay.
Yes.
The work continues with the working group.
Yes, that's good.
Thank you.
Equitable relief, I just wanted to recognize as well, we were working hard to bring this back to the commissioners. This was brought originally, one of the equitable relief requests was brought to the commissioners who requested a fiscal impact analysis between licensing data and the finance team, continuing to try to make sure that that is a robust and full analysis for your consideration of the universe that would be equitable relief requests. We did not feel that was ready for today, but I just wanted to acknowledge that we are looking to bring that back as soon as possible. Just wanted to acknowledge as well, although I believe the chair will discuss this later on in the agenda, the chair and I did meet with the Attorney General's office related to our question about votes between September 23 and 25. I'm not anticipating an opinion to be discussed today, so I believe the chair will discuss that later on in the agenda, but wanted to acknowledge that meeting.
If I could just, again, thank you, Director. We just to report, we did have a meeting with the Attorneys General, and basically the commentary that was made is that I believe that in terms of reviewing the votes to make sure that everything in the commission that was voted on, as many people recall, I had signed a delegation letter on September 14th, 2023, delegating Commissioner Roy. I had indicated to the folks in the Attorney General's office, I believe that this is solid ground. I've done enough research to recognize that there were a number of different times. As a matter of fact, when the former executive director designated an acting executive director, the comptroller said that that was not in compliance with the statute, and as a result, we had to refile a number of different papers because we did not have an appropriately designated or voted upon head of the agency. So I think that this follows along the same lines that the controller had us do. So we're going to be making sure, and this will again just be mostly ministerial, but to that end, I'm going to move one item on the agenda. This does not require a roll call vote, but I will be handing this to you. This is the letter. I am making a standing delegation because I am concerned that this is a little bit of a weakness in the statute. It is clear that the chair is the only person, once designated, to be able to delegate someone to have the vote between people, when there is four people at the commission and we're voting and we're having standoffs, which we saw embarrassingly a couple of years ago, it really doesn't make sense. And frankly, the state treasurer does not even have the authority to temporarily delegate an acting chair. That is not consistent with the statute. So in order to avoid any confusion, I'm making that standing delegation. And frankly, it comports, even though I did not support or sign off on the governance charter, it actually comports with having the governance charter actually creates a standing delegation that does not have the authority of statute. It's just an agreement. So this is making sure that we follow the statute, making sure that we don't ignore, because as a matter of fact, the standing agreement, I believe, was to have the secretary at the time be the acting chair, and that was ignored. So making sure that one always follow the law, making sure that we're buttoning things up, and that's what we will be doing going forward. So again, that's okay. I've made my statement, and we're good. So just want to move on with the discussion.
So I think one thing, just to point out as well, where we left the meeting on the 1st was that you and I would talk to the Attorney General's office. We've done that. Short of an opinion for the Attorney General's office, I'll work with the chair to try to schedule as efficiently as possible.
And again, I basically stated to the Attorney General, I do not need an opinion, but unless I'm doing something that is in violation of the law, they can tell me if I'm breaking the law, but they basically were very clear that this is very unusual to ask them for that kind of an opinion. And I did this as a courtesy. So we are following the law. We have the standing delegation, so there will be no confusion in the future.
Okay, and we do have this item later on the agenda as well.
Yes, I just said I moved it up in the agenda, so we don't need a vote on that. It was put there under a vote, and I just want to get it done, and we will move ahead. So again, you can continue with the director's report.
All right, so that item covered the later agenda. Thank you for that clarity, and we will continue on, you and I, with that discussion to make sure that those are scheduled for our discussion.
Thank you, and I will make a statement here just to make sure the public knows we're probably going to have to, rather than just having one meeting in November and one meeting in December as anticipated, we're probably going to have to, and I recognize that some people have important celebrations and we're going to have to work around schedules, but I think we might have to schedule additional meetings for November and December beyond the sort of regular meeting time to just make sure that we can address some of those. I mean, we probably could take, one afternoon or even an hour phone call to get something like that done. So just putting everyone on notice. Thanks.
One other item, a couple other items to cover here, for open meeting law trainings. This was a discussion, and for the governance charter, we have started to operationalize consistent review of open meeting law. So the first phase, which is including the leadership, which has been commissioners, chiefs, and directors, have gone through the options on the calendar through the Attorney General's office with a requested deadline coming up here. So happy to report that those folks that have been asked to go through that phase 1 have done that, and will provide an update to the commissioners on phase 2. One other thing I wanted to note, which is covered within our social media presence, which was kind of a reposting of an agency referred to as Mass Budget, did a report on the CCC with a specific lens through our equity programming and the impacts of it. One of the things I think that the report does very well is something that we have presented to Ways Means in the past, which is all of the benefits of the cannabis revenue that comes into the state, where that money goes, because it does not come to us, it goes to the MRF. And the MRF, what it is therefore paying or allowing to happen by other state agencies, including BSAS for substance use programming, et cetera. So I just wanted to highlight as well in this public meeting that report covers a lot of the materials that we've discussed, obviously, and we're happy to work with Mass Budget to spread that message. But anybody who wants to check that out, we've put that on our social media as well, and they have presented that document. And then just lastly, it was already mentioned, so I won't cover it further, but our Chief of Investigation and Enforcement, Noam Jones, on the 2025 Governor Paul Cellucci Award for Leadership and Mentoring in State Government. And I would just point out, in classic Noam fashion, she pointed out all of the other folks who were also deserving of this and all of her colleagues, but I think we all understand that Noam was nominated and awarded for a reason, which is the phenomenal job that she does. So thank you with that. We will move on to the items that are specifically listed under the Executive Director agenda, the first being an 8th anniversary video, which we are prepared to play. And it is a short video. That. And so thank you as well to the digital team who continues to produce these items for our website and for the organization to highlight the work of the agency. A couple of the other videos that we've covered recently include within the social consumption discussion how our regulations are updated and how the process works. And so I think these videos have been well received, and so great work by them. Moving next to the budget development update. Before I hand it over to the CFA, I just want to highlight, as of right now, we're working off an assumption that the FY27 budget request will be due by the end of this month, but that has not been directly expressed to us as of yet. So it's possible that that deadline might change. Obviously, there's a lot of things going on at the federal level that is impacting the state's processes. So within that, I think the CFAO, Lisa Schlegel, can provide some updates on where we are in the process and take any questions.
Thank you. Thank you, Edie. Thank you, Chair. Thank you, Commissioners. Appreciate the opportunity to have a conversation with you. Before we jump into FY27, I wanted to give an update on where we are FY26. Right now, we're about 20% spend in through the first quarter. And we have filed a supplemental budget last week for an additional $2 million, $2,025,000. The request for that funding is primarily staffing. We're looking to, number one, cover the deficiency we currently have in our current staffing. The ability to give COLA or merit increases in January, and to fill the frozen positions. We currently have 7 positions still frozen in the budget for FY26. With that, we also have funding requests to continue our SEP program a little bit more than what we've got budgeted. We have 90,000 budgeted. The original ask was 250, so we still have a gap there we're trying to cover. And in addition, we have product safety testing and lab testing protocols. That's what's in our current request for supplemental. In addition, we went to EOTS with a proposal to upgrade or replace the MMJOS system. We met with them. I was hoping to have an answer before today. We haven't gotten a response on that. If we get that funding, the procurement will begin right away on that. If we don't get the funding and we do get our supplemental, that's going to shift our priorities a little bit, because right now our IT infrastructure is our main concern. So that's where we are with FY26. With FY27, as the ED said, we do expect to get the final budget in by October 31st. That's traditionally our deadline. Again, we haven't heard that. We know with the state there is other things going on, other priorities right now, whether they'll shift that date or not. We will bring the full budget proposal back to the board for an approval. But just to give you guidance on where we are and the guidance we gave our departments, and to get any feedback from you before we get to that, we wanted to have a discussion about it. Same things that are in the supplemental will be our priorities for FY27. In addition, we have social consumption. That's going to be a major ask for us. Last year, we requested $30 million, and that included 17 positions. We will be requesting most likely at least $30 million again in FY27. We're finalizing those numbers. Most of that's going to be I&E for social consumption. Again, health and safety, IT infrastructure, additional positions for secret shopper for social consumption. All those are our priorities. And some professional development funding is also going to be one of our major asks. So again, we don't have final numbers yet. I wanted to show what priorities we've given our departments, and any feedback that you may have on priorities that you feel we are not covered here or that should be covered. And that's essentially where we are right now. Our staffing costs will most likely, just for current staffing, be 16 million. So as you remember, our current year budget is 19.7. It's mainly staffing right now, and we have IT infrastructure that's a major cost, and that's before we even get to the programs and health and safety and licensing and I&E. Just to make everybody aware of where we're sitting right now, where we hope to be, and again, we'll come back when we have final numbers.
Any questions from the commissioners? Thank you very much. Oh, go ahead. Go ahead.
Quick one. That number that you were talking about, the $30 million, that mirrors last year's request. But remind me, that was on the kind of request of A&F that we give them everything. So it's stuff that might be fundable through EOTS. It might be, but it was kind of like, give us the entire requirement list. So that's why I think people saw such an exponential jump between our budgets, between the the previous 2 years is, I'm assuming that's what we're still is.
That is still what we're looking at. And again, we're kind of shifting all those positions that we requested last year are going to be shifted to positions again, but for social consumption, secret shopper. So a little bit more focused in FY27. If you remember some of the things that we requested in FY26 that we didn't get, there's still things we need. Education for social consumption, IT infrastructure. If we get money from EOTS, then we can shift those. Right now, we've actually been advised to keep them in both until we see where we get them. We don't want to assume we're going to get money from EOTS. Let's keep it in both EOTS and through our operating budget. And if we get one, then we can reallocate or refocus our efforts. The other things, just to go back, we had to reduce the social equity program last year because we didn't get funding. Again, adding that back in for full funding. So again, it's a budget. We'll see where we end up, where our priorities are. If we get money from EOTS, we can shift some of this. We know we need a lot of money to get social consumption off the ground. We will probably be able to phase that in. We've seen a number of requests for additional positions based on that. Do we need them all in year one? Can we phase them in over multiple years? And that's what we'll be looking to do.
Thank you. Thank you.
Commissioner Roy?
Thank you, Jared. Thank you, CFAO. I appreciate the update too. So we're about a quarter in on the fiscal year and we're at 20% spend. So it's as opposed to being 25%. So I guess that's positive new development. And are there any departments that are running over at this point, or is everybody pretty much where they need to be?
We're pretty much where we need to be. Again, social equity didn't start till September, so there's a delay in that. We had a number of vacant positions on July 1 that have been filled. I think we filled about 6 or 7 positions in July and August. So they didn't start on July 1, but we'll see them going forward. So we should increase that number.
And you mentioned the social equity program had to take a cut. Do you know offhand how much?
How much of a cut?
Yeah,
We had requested 250. They were awarded 90.
Okay, and so I appreciate the refocusing on priorities. I sincerely mean this around personnel, hiring, merit increases, COLA increases, IT infrastructure, because my point of frustration last year was we had to cut SCP and we tripled our outside legal budget to over 300,000. One could argue that took away from SCP because we spent over $300,000 on outside legal counsel. So you and I've had these conversations offline, and I asked you to flag if it goes even more. I think we encumbered 100,000 for outside legal counsel. We did last time, and we went to over 300. So if it goes over by even a cent, this board needs to know, because it takes away from our mission. That took away from our mission, 300,000 in outside legal counsel. So that's unacceptable. And I know, everybody's got a renewed commitment not to see that ever happen again. And so I have to, as treasurer, I have a fiduciary responsibility to this commission, and pointing out that literally took away from our mission of helping SCP to go to outside labor counsel over 300,000. So I said my piece as treasurer, and I've shared this frustration with you. And it's not you, Lisa. So you're amazing, and you and your team are amazing. But I think we all have a commitment here that no one wants to see that ever happen again at the commission. So thank you.
Point taken, and we will notify you as we even get close to that threshold.
Thank you.
Can I just echoing what Commissioner Roy said to the director, when we're looking at what our priorities are, how do we take, like we tripled our budget on outside legal expenses. How do we, in the middle of the year, who makes the determination whether or not, like, we knew that we had to cut the SCP program because we had not spent the money last year. I understand that there was some confusion there. So as we are going through the year and we see that our central mission, one of our central missions, is social equity, and we can't run that program in a timely fashion because we're tripling our legal budget. How are those policy decisions made? I mean, I know we have numbers, but how do we, as we're going through the year, looking at, and thank you, we're 20%, we're 25% through the year, but how do we make that decision? And do we have an obligation in looking at the budget and saying, maybe we should be really refocusing on our mission, maybe every quarter. And maybe it's not even asking you this a question because I think it's time to hit reset, but maybe each quarter we take a look and ask ourselves, where are we budget to actual? And then how does our budget to actual meet our mission? So again, I don't even think I need a response unless you want to, but it's really something I think we probably should be doing, especially when something like social equity basically gets gutted because we tripled our legal budget.
Certainly. So, I mean, just a couple of thoughts on level here. Where we are right now, the CFAO, CPO, and I, with the hiring freeze, for example. So what we've communicated out to those who've requested for those positions for us to lift the hiring freeze, where we don't currently project to be able to do that at this moment, was that we will check back in after quarter 1, which is ended September 30th of FY26. And then if we are not still projecting that we can post those positions, which we are still in analysis of, then we would check in again after Q2. And so we'll provide those updates to the board as well. I think generally speaking, this organization has done a phenomenal job, and I can't take credit for it because a lot of this was prior to my arrival. For example, the SEP program, what we've done is split the cost of the development, a lot of the technical assistance.
But it's it's not focusing on, you know what I mean? The question is not how we run the program. It's how do we, during the year, make sure that when, like the toothpaste tube, when it's going in one direction and something that's far more important or critical to our mission is getting short shrift. Again, it's not, we don't need an explanation because we know what happened, but it's something that I would think that maybe going forward, we could work together, that on a quarterly basis, we take a look at budget to actual and how do we make sure that actual fits our mission? And that's really, it's again, we don't need to go back and rehash because I think we all care about and we're proud of the social equity program itself, although we need to still do more to make sure that we are helping people not just go through training, but that they actually become licensees and find gainful economic benefit from the programs that we're running. So anyway, I thank you for that. And Lisa, I thank you. And I know that Commissioner Roy has been working closely with you. And I've told her I did this when Commissioner Camargo was treasurer and Alyssa Stack was managing a lot of this stuff. So I would love to join some of those regular meetings with you and Commissioner Roy. So thank you. And I will stop. And I don't know if Commissioner Stebbins has any questions, but would you like to continue or are you wrapped up?
I'm wrapped up. The only thing I would point out is that this does not include it. Our FY27 budget will initially not include anything for H4 the House bill.
Mm-hmm.
That will be supplemental if and when that is.
So it's important to note, obviously, there's a couple of things I would point out to Commissioner Stebbins' earlier comments on the 30 million and kind of where that sits historically of where the commission has had its annual operating budget. Again, I've found folks who don't understand that we do not keep any of the revenue. It all goes to the MRF. We get an appropriation. So, we had a tracking, Commissioner Roy, Commissioner Stebbins, CFAO, and I presented at Joint Ways Means my second week, so March approximately, which demonstrated what our budget requests are historically over the last few years. First, the funding was about 75% of our request was getting funded. So there were things that on an annual basis, to the chair's point, we are making decisions across multiple different areas of our mission that are impacting sort of all areas of the organization. In FY26, we ended up at about 66% of our requests, right? So a lot more of those difficult decisions had to happen to project that we could get through the fiscal year, which is what we're going to check in quarterly on. And so just to put that in perspective, that is not in the mass budget report, right? The mass budget report puts it in context of all of the revenue that comes in, where the CCC's budget sits compared to the money that goes to BSAS, et cetera. What it doesn't show is what we present at the Joint Ways Means, which is we're presenting a budget that we think we need to do to uphold our mission, and we've gotten 75% a couple of years of our requests, most recently 66%. And then just to highlight specifically what the significance of what the CFAO just said about us not having the House bill assumed in this budget request. Hemp is a major expansion of our mission, theoretically, intoxicating hemp. Hemp is in the news right now, and I think that's for good reason. Commissioner Roy and I had done a piece with WCBB previously where we sort of had to bring some of those questions to light, and I'm glad that those are coming up. If we have an expansion of our mission that significant, it would be outside of the $30 million approximate ask. Additionally, the way that the House bill writes the accounts receivable, for example, would most likely put some costs onto our shoulders that we would not be able to do within our existing budget. So again, just to kind of put in context, what is a simple statement from the CFAO, we don't have that in this currently assumed. That is a major undertaking should that House bill move forward that we would be prepared to quantify in a supplemental.
Thank you. Thank you, CFAO. So we'll move on to the next issue, MMJOS.
And the CTIO is going to present some updates on MMJOS.
Okay. Oh, yes, sorry.
Good morning. Thank you, Mr. Executive Director. Thank you, Chair. Thank you, Commissioners, for an opportunity to give you an update and to the public as to what we're doing. As mentioned, MMJOS is one of the two major tech platforms that we're looking to make improvements on. So I wanted to share for you in the industry what our plans are moving forward at the moment. Next slide, please. So first of all, I want to stress for anyone listening that these changes only affect the industry. These are not patient, caregiver, or certifying healthcare provider changes. This is the changes are focused on the industry side. So the MTCs and any point of sale systems and integrators out there. So we've begun the process of transitioning industry functions from our existing MMJOS platform to our licensing platform and into our seed to sale platform, with a goal to make this platforms more efficient. Right now, our older MTCs still have their licenses managed in MMJOS, while the newer licensees are all in MassAIP. We've begun the process of moving those MTCs into MassAIP, so we'll have a single platform for licensing to be managed from. Again, the goal here is to make it streamlined for both the MTCs and for the commission staff to have one point. These are plans that we had in place to move forward on, but we're also highlighted by the auditors just having, limiting platforms and the spread of platforms we have. Next slide, please. So as I noted, phase one, so we have a 4-phase plan here. So our phase 1 is the older MTC transition. There are 84 MTC active and then 31 older licenses that are not currently active that are in the process of being transitioned. We've got approximately 50 of those in our test environment in MassAIP to work through the transition, make sure the data gets moved over and QC'd, and we'll begin moving those over to production within the next couple of weeks. Our team will be reaching out to each MTC as their account gets moved over to go through the process of logging in and creating their account and provide with some training materials, and that'll be done on an individual basis with each one of them. 2 is the transition of the patient transaction reporting. So right now, as an MTC, when you go to make a sale, you have to check MMJOS to see what the patient allotment is and if they're still an active patient. Then you go to Metric and place the order and record that transaction. And then you have to go back to MMJOS and enter that transaction back in for the individual patient. So they're having to do dual entry. MMJOS does not support APIs, so there are only a couple of third-party integrators who have done any sort of integration. So not all point of sale systems can report back to MMJOS. They use a technology called screen scraping, which essentially is emulating if someone was sitting at the keyboard typing the commands in order to interact with MMJOS. Yes, Chair.
Can I just ask a question? Are there data reconciliation apps out there that could help with this without having the API?
So we would need to build something between Metric and MMJOS. This transition is actually that process. So, and we're going to move all the sales transactions into Metric where they really should be. They're already being recorded.
I'd like to have an additional discussion because I know nothing about technology, but I know just enough to be dangerous.
Okay.
And I think that there might be some potential solutions that might be less manually intensive, but may also be able to help us do something like that. But we can have a conversation.
Sure, Lois. I mean, once this is done, the manual process will go away. So that's part of what phases 2 and phase 3 will be.
But is this going to be dependent? I'm sorry to keep, but is this going to be dependent on whether or not we get the funding to do this, or is this within our budget right now to accomplish this and move through it?
So These phases are already in our budget. First part of phase 2 was started under our FY25 budget, and then we have allocated money for in the FY26 budget for that. So this is the setup. This at the end, MMJ still is operating exclusively as a patient portal.
Yep.
And all sales transactions are now in metric. The procurement is to then replace MMJS with a more modern, more up-to-date platform, and that's when we talk about an updated platform for the medical is for the patient portal. So this is actually a precursor to making that transition. So the patient portal MMJOS is over 10 years old. It was created by the Department of Health. Older technology is not fully accessibility complete, and we receive our.
When you say not fully accessible, do you mean in terms of like
ADA,
persons with visual
yeah.
disability? Yeah, I think, okay, yeah.
Our customer services team continually receives issues, challenges with password resets, viewing data, understanding even how to interact with the platform. So the goal in the procurement that we're looking for is to replace this with a much more modern, up-to-date.
So I think that we might have a meeting set up, but this is one of the things is that sometimes we don't know what we don't know is out there.
Mhm.
And so, if there is an opportunity to have that, deeper discussion, obviously we're getting all sorts of people. We've got bigger, better, cheaper, but how do you sort of understand the potential landscape that you might not even know about that technology? No one's knocking on your door yet to say, well, we want to, sell to the Cannabis Commission. How do we know what's out there? What are we doing to say there might be something new, better, or maybe something from a different industry that might serve the function? Because, what I've seen is that there's a lot of cannabis oriented stuff that's out there that it's out there, but it might not be the best. So, just asking again, this is really just for me, informational to understand.
People are reaching out. We
Yeah.
occasionally hear from vendors
Yeah.
interested in any and all technology procurements across all platforms. So I'm actually the co-chair of the Metric Canra users group.
Okay.
And that has 18 to 20 states involved on a regular basis, and we talk on multiple topics beyond just metric, including medical patient programs. So I talk with many of my peers across the country about the platforms they use. And so we're, at least within the industry, very good question on what else is out there on the broader side of things. I'm certainly glad to have a further conversation about that. That'll be part of our strategy as we go to procurement of whether it's a full RFR, bring in the whole world, or a more targeted one, a specific RFQ to those on combine approved contracts, which would make the process more quick to occur. We did do an RFI around the licensing and patient portal a couple of years ago, so we have some feedback. It's a little bit staler at this point, but it still, I think, gives us some insight as to what the industry has out there, and that was an open RFI.
So again, a friend of mine used to be, I don't know if his title was actually Chief Technology Officer for the Veterans Administration. And generally the VA deals with the 800-pound gorillas, as you can imagine, with 50 lobbyists for each company. But they always set aside some money for some innovative solutions. And this was how they got new ideas that they might not have even known about, that gets away from a lot of the legacy technology companies. So I know that you know what you're doing, but I'd love to talk about this further to just get myself up to speed. So thank you.
You're very welcome. Glad to talk tech anytime.
But I don't understand.
That talk on tech.
Commissioner Roy? Yeah.
Thank you, Madam Chair. And thank you so much, Paul. And you had mentioned that originally that this was not going to impact patients. This was more, MTCs, but I think it does, but maybe in a positive way. And what I want to share is I hear time and time again, it can take a long time for a patient to check out at an MTC because of, going from MMJOS to metric back to, back and forth. Can you talk about these moves, how that will help that at the checkout line for a patient? Do you see any improvements there?
very good point, and yes, because the, first of all, almost all of the point of sale systems that are out there that our licensees are using, not all of them, but almost all of them are already integrated with Metric on the patient side. Obviously, they're doing medical in other states, so most of the point of sale systems have built their integration with Metric for the patient management already. So for those MTCs that are currently doing it manually, having to do that back and forth, if they have a point of sale system, should be a easy transition. That will reduce 2 checks of logging, and should, in theory, not done any research to measure how much time would be saved. But I would certainly, I think logic shows that there would definitely be an increased speed in a checkout process.
And the allotments will be easier to see, right?
Correct.
Okay, that's helpful. Thank you.
Thank you, Commissioner Stebbins. Any questions or comments?
Yeah, no, I think, thank you, Chair. I think you've addressed some of those. Obviously, it's moving a very antiquated system over to Metric, so the transaction piece of it would be watched. But I think the chair raises a good point. Now that we have had, and you're interacting with other jurisdictions who have incorporated medical more recently than what we have, I would be interested in kind of seeing where I think to pick up on the chair's point, what the evolution has been. It would probably help Kate and her team to cut down on calls about just how do I access the information I should have access to, and finding perhaps a more user-friendly process for the patients.
Yeah, and that's certainly a big part of the procurement is when we went to EOTS, and that was certainly a major selling point as to why we needed to replace the platform as a whole. And in my vision of the patient portal is the patient portal, whether it's MMJOS or new portal, is patient centric. We talk about mobile first. MMJOS is not built with a mobile in mind. It's low tech. It's hard in most of the patients, most caregivers. It's a phone or a tablet they're using, not sitting in a computer. Caregivers, the certifying healthcare providers may be more commonly on a computer, but the vast majority of when you look at the total numbers, the vast majority of our users being patient and caregivers, around 90,000 folks that are probably in the 80 to 90% range using mobile devices to connect.
Commissioner Roy?
So this new system will be responsive design?
Well, that's what we're having is we're finishing up the requirements, and that's one of the things we've included in the requirements. That's again one of the things that we've provided EOS as a major driver in wanting to make this. And so do away with we're anticipating a significant decrease in the number of calls that would need to be made around password resets, just really basic functionality in a well-integrated, well-developed system that doesn't exist today. So, but I want to mention that this is beyond what this discussion is today. That's procurement. This is such a pre-procurement, so I can make sure we understand.
Right.
Commissioner Roy?
Yes, and you had mentioned about the lack of ADA compliance. So that's really important. And you had mentioned, so will this help with that so that folks, many of our patients struggle with, may have disabilities. And so will this help alleviate some of that right now?
This first transition, not as much. We will work with, and we've worked with JD to make some minor changes. For those of you who are not aware, in April 2026, the ADA requirements increased significantly for state and local governments. It's called WCAG 2.1 requirements go into effect for all state agencies, both internal and external. So
Could you, I'm an acronym person, what WCAG?
Forget exactly, I'll get to the, but it's web access guidelines. And it's increased level of the ADA accessibility for websites, but all state agencies and anyone over 10,000 citizens are required to have this in place for April 2026, and not just for the public. It also is a requirement for your internal staff as well to be compliant. So again, this is part of the procurement work, is heading towards that compliance, and this is a common conversation at the state CIO level of getting the state.
Where is that discussion happening about the WCAG, the WCAG, the CAD?
WCAG.
It is the Web Content Accessibility Guidelines version 2.1 level AA.
Yes.
Where does that sit? Who does it sit under?
Within the commission.
Within the administration.
within government, within government.
So that's under, so there's multiple overlap. So EOTS is leading within the executive
Where does
office.
EOT sit? I was gonna ask you that before, but.
So they're one of the executive office secretaries, so.
But I'm saying, does it sit under the?
Governor.
But I mean, which secretary under the governor is
It's
it?
the secretary, it's the secretariat itself, so.
That is the secretary.
Yes, it's
Okay,
secretary,
okay.
yes.
Okay, thank you. Go ahead, Commissioner Rankin.
I have a question, for our,
Jason Snyder is.
for either, probably more for our CFAO. I think we should almost lead with that, like when we're applying for a SUP, that we are not ADA compliant. That, I think that's like a lead, that's the lead. We're not ADA compliant.
I'm not saying we're not, but we're certainly not the new 2.1 compliant. We have some compliance, but it's not certainly to the new 2.1. So I want to be careful that we're not saying we're not ADA compliant at all, but we're not fully ADA compliant.
But that means we're not compliant.
Yeah.
I guess what I'm saying is,
Okay.
right?
Yes, Director?
Madam
Yeah.
Chair, thank you. So it did certainly was a major component of our discussions with EOTS on the more full upgrade, what we're looking to do with MMJOS. So it was a major component of what they're looking at as well. And also, as CTIO mentioned, this was released April 24 of 2024 by U.S. Department of Justice. And is found on the mass.gov website. And so there is, obviously a period of time where folks are getting into compliance. And so, but as we heard from EOTS in our presentation, the CFAO, the CTIO, that I think that is a major component of why we feel that this is a priority. In addition to the needs and efficiencies, it's a compliance issue.
Thank you.
Thank you.
Have I interrupted you enough for you?
Whatever, I'm here to answer questions,
Okay.
so. if you're-
But are you done with your presentation?
I
Are you good?
I have two more pages to go.
All right.
so
All right, thanks.
move it quick.
There, I'm sorry, I missed an answer.
Sure, right.
Go ahead, Commissioner Ray, sorry.
CTIO, did you explain? Oh, can you go
Back a slide.
I went to point to it.
That's all right.
Can you, like, as, maybe I'm like a fourth grader, honestly, can you explain that last bullet?
Okay, so phase 2 is to begin allowing Metric to track the patient transaction. So while the transactions are being tracked in Metric, they're not tied back to a patient. So there's just, we know the sales occurred to an MTC, but we don't know the patient ID number is not recorded in Metric currently.
Okay.
So phase 2 is JD software. And this is the FY25, FY26 budget split is developing the ability to via Metric's API to push the patient IDs to Metric. So they have that. So that's part of phase 2 is begin to get that into Metric. We'll then begin requiring the MTCs to report the patient ID when they record the sales transaction that they're already recording, but they'll need to add the patient ID number to each transaction.
Commissioner Ray?
Which is all HIPAA compliant.
Correct, because it's only a patient ID number. Metric does not have any other patient
I see.
identification.
Okay,
No
thank you.
diagnosis, there's no names, there's no,
Okay.
it's just it's either a caregiver ID number or a patient ID number.
Thank you. That's helpful.
Thanks. Go ahead, Paul. Thanks.
So that's phase 2. It will require double entry still, but it's really just adding one field to what they're already reporting, which is the patient ID number. Now we can turn to the page. So phase 3 will then be the moving over the actual patient full allotment management. So we need more than 60 days. It'll be about a 90-day period of reporting sales in Metric and in MMJOS. When we're sure that's all working and we have that history, there'll be a transition date that Metric will become the system of record for the patient allotment, and MMJOS will just query from Metric when a patient logs in and wants to see what their allotment in their history is. They'll still log into MMJOS. MMJOS will just query Metric to get the updated information.
Commissioner Roy?
This is probably more for CFAO. So we're eliminating eventually MMJOS, sunsetting it, or no?
So at the end of these 4 phases, MMJOS will still exist as the patient and caregiver and healthcare provider portal, but not sales transactions. So patients will still log in, caregivers will still log in, and healthcare providers. Then we're working on a procurement that would be to upgrade and or replace that patient portal as one platform into itself.
Okay, so I have a budget question. So now there's an additional function in metric and one less function in MMJOS. Did that affect our contracts? In other words, with MMJOS, we're using one less functionality, and with metric, we're using one more functionality. Was there any?
So there's so the answer is right now, no. There's actually a little bit of increased cost of the work that needs to be done. The reason why is that MMJOS was a platform developed by the Department of Health. It was fully owned by the Department of Health. It was transferred to the commission. So we actually own the MMJOS platform.
We own it.
We contract with JD Software to host it, operate it, and support it. But the functionality in it, we wholly own. So it's not like they're selling us modules and such. So as we take some functions away, it's still our platform at this point in time. So unfortunately, the answer is no, that we're not able to turn it off and then therefore save because of that ownership.
But do we own more now? Is our metric contract go up because now that's like one more functionality that?
That was included in our new statement of work with metric, was this patient management piece. And that was built into the existing contract. So there's no additional cost. But this is, like I said, this has been planned for a little while, but certainly accelerated both for the procurement, but and also in response to the auditors.
Thank you.
Thank you. Any other questions?
And I have one last, and then the last piece is once that patient minute allocation moves over, the last piece of it is then moving the agent registrations from MMJOS to Mass CIP. Today, all the MDCs, regardless of whether you're licensed in MMJOS or Mass CIP, still have to go to MMJOS to register agents. So agents for medical are in MMJOS, agents for adult use are in Mass CIP. There's a data connection behind the scenes that JD every night pushes the agent registrations from MMJOS into Mass CIP. So then it's sent to metric. So it's this whole, so clearly simplification in this. So ultimately we'll end up all agents, adult and medical, in our licensing platform with all licensing, and then patient, caregiver, healthcare provider are all in the patient portal. And at that point, MTCs will only have two platforms to deal with, metric and Mass CIP. And again, most of their point of sale systems do the work for them.
Yeah. Wow. Okay. Thank you.
Thank you. Anything further? Any questions? No? Go ahead, CJ. Are you?
That is all I had for you today. So.
Thank you. I really appreciate it. I don't understand half of it, but I appreciate all the work you're doing and trying to make this more efficient. So thank you.
Thanks.
Thank you as well.
Moving on.
To the IT team that the CTIO works with. So a lot of work for everybody, and we will have other updates as well. I think one of the things I would highlight is
last page, yeah.
I think one of the things I would highlight as well that we highlighted for EOTS in our presentation is that this is one of our IT infrastructure platforms, right? Mass CIP, which is our licensing software, is also, you know, as much as that discussion was robust, is a even larger discussion. So thank you to the CTIO.
Excuse me.
There was one last slide. I think we've covered most of these points already. So just the summation of it. So I'm good.
You all set?
Yep.
Okay.
Yes, I've had a request for a brief 7-minute break. Okay, so if we can return at 11:35. Should we need a motion? Do we motion to temporarily
Take a recess.
take a recess? Yes.
So moved.
Second.
All those in favor say aye. Aye, opposed, none. Okay. Okay. Okay, we are back from brief recess and we will ask licensing manager Christine Moriarty, or is Olivia? Okay, I have it. Okay, sorry, Director Cole is going to be.
Thank you. Hello, everyone.
Thank you.
All right, can we go to the next slide?
Just a little distraction outside. Sorry about that. And sorry about that, Director Cole. I'm just
No worries.
making sure I got the right person here. So.
All right, in terms of highlights from licensing data, we have 1 application awaiting first review and 32 applications awaiting supplemental review, and you can see the number of certified active patients. Next slide. Here, I will just highlight that we have added 2 licensees that have commenced operations since last month. We're maintaining a steady around 9.6% increase since October of 2024. Next slide. For the pizza tracker, some of the same information here. And again, just the highlight is the fact that we've had 2 licensees commence operations since last month's report. Any questions?
That's the Commissioner Simmons.
Thank you, Chair. Just one question on this, and fully appreciate you may not have the answer right at your fingertips. You know, I would be curious at some point if we could look at, you know, the pre-certification for courier delivery operator. Is there one more? Maybe it's just those 2.
Are you talking about the pre-certified endorsement?
Yes, sorry.
Okay.
Pre-certified, the pre-certification for marijuana courier pre-certification for delivery operator. I'd be interested because once they're done with pre-certification, they get the endorsement, they funnel back into another line, right? They will funnel back into the courier license application process or the delivery operator.
Correct.
I'd be curious, at some point, if we can look at the data to see how many have made that successful transition and where they're kind of moving through the process. I'm doing it, Madam Chair and Commissioner Roy, I'm trying to look at the value and the usage of this pre-certification process as it met the intended results that we had hoped for. But anyways, didn't expect you to have that number at your fingertips, but.
Oh, definitely, yeah.
Look at that.
We'll work with the data team and see, what numbers we can pull there to show you, give you a picture of that.
Thank you.
You're welcome.
Thank you.
I think Commissioner Roy.
Oh, Commissioner Roy, sorry.
Thank you, Chair. Again, Dr. Cole, I just want to thank you. I had requested the column for active commence operations. I think that's a critically important column to have. If you look to the left of that, the commence ops, at one point we were up to 766 and now active is 684 for a myriad of reasons, right? But it's good for commissioners to see, what's actually out there operating. So I want to again, thank you for that column.
No problem. Yeah, that was a great addition because like you said, it helps paint a good picture of what is happening within the industry. Okay.
Thank you.
You're welcome. Next slide. Here we have the active cultivators. We had a couple of licenses either expire or surrender, so there's a minor, change in the numbers, but I think it was only a couple of licenses, so not a large number. I believe it was 2 altogether.
Thank you. Oh, sorry. I'm sorry. I'm trying to make sure that I'm following the schedule. Commissioner Wright, apologize.
Should we add that column here then?
If that's something you want to see,
So that would be helpful.
just add it to my notes. Okay, next slide. This slide shows the difference between outdoor and indoor cultivators, which Commissioner Roy, I know you had asked for. And again, not much to highlight here. other than those two surrender slash expiration closures. So this is just showing the difference between indoor versus outdoor licenses.
Thank you. Commissioner Stebbins?
Thank you, Chair. Director Cole, remind me why we put that 22 in kind of a green shade.
I think it's just to highlight, it's to highlight how few, I guess, how many outdoors we have compared to indoor.
All right, thank you.
Commissioner Roy?
I think if memory serves me, that's correct, because New England is, a tricky climate, right? It would be outside cultivator versus out in California.
Exactly.
So I think that's why
Right.
we did that.
Yeah.
One other question that I would have, and again, you don't need to answer it now, but I'd love to learn a little bit more in terms of canopy. How much canopy is in the indoor and versus outdoor? You'd assume that outdoor, might have larger canopy, but I don't know. Again, it's not anything to answer now, but it's just something I'd like to understand.
Sure.
Thanks.
I'll
Go ahead.
add it to
Thank
the
you.
queue.
Thanks.
All right, next we can move on to the HCA slides. All right, so for HCAs, the total number of HCAs we received has gone up roughly by 50 since last month. But also to note is we also added 50 compliant HCAs to our numbers. So that's quite a bit since last month. In terms of compliant HCA towns, so again, those are towns that have at least one compliant HCA. It doesn't mean that they have every single HCA compliant. There was an error in the way the data was pulled because everything's a manual process. We reported 163 last month. It's actually 161 towns. So just wanted to highlight that it was off by 2. But, as you can see, our list has come a long way from when we started. Like we're now a year and a half into this process. So,
And Director, how many communities are yes communities right now? Do we know?
I would have to loop in DGAP for this. I don't know off the top of my head. I think he's
Again, I don't need the information right now, but I just would like to understand what that is.
yeah.
Thank you.
You're welcome.
Thank you.
Next slide. Here, what I usually focus on is the extensions. So again, we are literally keeping the same pace of just adding 100 extensions roughly monthly. So meaning that we receive at least 100 extension requests every month. And it seems like now we have been steady at this pace for at least, I want to say 3-4 months, the last 3-4 months.
Thank you. Go ahead, Commissioner Stebbins.
Thank you. So the kind of cadence we're on with extension requests, I know it's on the agenda, obviously, later for us to discuss it. Trying to understand the population of the communities where those 100 extensions are coming from. Do you have a sense of like how many communities we're talking about?
I do not. That's something that we could also loop the data team in to see if, Paul, if we could ascertain that. I'm assuming we would be able to. It's just everything is manual for HCA, so that's why it would probably take some time for our data team to assist with that. But there would be a way to figure it out.
Okay. All right. Thank you.
Thank you.
You're welcome.
Good. Okay. Thanks, Director.
And that is it for me.
Okay. Thank you.
You're welcome.
All right, and now we will move on to, again, my eyes have moved to there faster. Moving to staff recommendations on changes of ownership presented by licensing manager Christine Moriarty. And we are starting with Cosmopolitan Dispensary.
The licensee here is Cosmopolitan Dispensary, Inc. They are seeking a change of ownership and control of one adult use license and are requesting to add 2 entities. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Are there any questions or comments from the commissioners? Hearing and seeing none, Commissioner Stebbins, I'll entertain a motion to approve the staff recommendation on the change of ownership for Cosmopolitan Dispensary.
So moved.
Commissioner Roy, do I have a second on that?
Second.
Moved and seconded. Take the roll call. Chair votes aye. Commissioner Stebbins?
Aye.
Commissioner Roy?
Aye.
It's passed unanimously. Moving to Green World LLC.
The licensee here is Green World LLC, and they are seeking a change of ownership and control of one adult use license and are requesting to add 2 entities. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Any questions or comments from the commissioners? Hearing none, Commissioner Roy, I'll entertain a motion to approve the staff recommendation on Green World LLC.
So moved.
Do I hear a second? Commissioner Stebbins?
Second.
Having been moved and seconded, I'll call the roll. Chair O'Brien votes aye. Commissioner Stebbins?
Aye.
Commissioner Roy? It is unanimously approved. Moving on to staff recommendations on renewal licenses. Now, this is, I think, we will be doing this. It's voted on as a group, but I wanted to take out, we have two. Why don't we vote on these as a group, and then we will move to the ones where Commissioner Stebbins has conditions. So if I shall, and I just want to make sure I'm getting the procedure right, we will, I will, unless anyone has any questions or comments, we will be looking at license 1, 2, 4, 5, 6, 7 through 24 on the list, 26, 27, 28, 29, 30, and 31. And just making sure I can state that I don't need to state them individually. We're taking that as a group. Okay. So with that, are there any questions or comments from the commissioners about any of those renewal licenses in the group? Hearing none, I will entertain a motion to approve those recommended license renewals. Commissioner Stebbins, will you make that motion?
So moved.
Commissioner Roy, will you second that?
Second.
Having been moved and seconded, we will take the roll. Chair O'Brien votes yes. Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
It is approved unanimously. So now we are moving towards alternative therapies group 2, and Commissioner Stebbins has a condition.
Sure. Thank you, Chair. This is a condition on the renewal of Alternative Therapies Group 2, license number MRR 206952. My proposed condition is within 30 business days of approval of application for renewal, contact CCC Licensing Division and provide response as to whether licensee's goal number 2 should be redefined and provide an assessment on progress toward goal number 2 in the licensee's positive impact plan in accordance with 935 CMR 500.101 1A11 and 935 CMR 500.1034B. Again, this is seeking their help to kind of clarify and how they're measuring licensee's goal number 1 and 2. I know that the licensee received multiple RFIs from our licensing team on these same topics and did not seem to be responsive. So that's why I'm proposing to add this condition to their renewal.
Commissioner Roy?
Through the chair to Commissioner Stebbins. Respectfully, on these conditions that positive impact plan conditions and diversity plan. So today we're going to talk about conditions, expired conditions. And it seems that there's a pattern here that some of these are like these on positive impact plans and diversity plans. We don't really, what's the enforcement mechanism on positive impact plans and diversity plans?
From licensing's perspective, we don't get into the enforcement part. We just send RFIs. I'm not sure if EC is online, but to my knowledge, I don't think we have undergone any enforcement mechanism for non-compliant individuals or licensees that didn't respond to diversity plans.
So my point is, if we have, earlier we said 766 commence operations, and we're not monitoring these and enforcing these. Yes, it's a requirement. So I don't understand like what the goal is with conditions on them, because we don't enforce, it's not like we're enforcing. There's no teeth here. I'm going to be honest, there's no teeth. It is a requirement. We check the box, but we don't have a process in place where we constantly monitor these for adherence. Is that accurate?
That's accurate. From licensing's perspective, we only look at this typically at the renewal phase, unless they choose to send us an updated, halfway through the year. If they decided to update their plan, they will send us an update.
Right.
But yeah, in terms of enforcement, and I can loop in EC and look into this further as well.
So we're going to have this conversation about the expired conditions. So I just want to be mindful that we're not enforcing them on everyone. So if we're selecting a few to have enforcement or to single out, I just don't know. I just have questions about, I mean, this is a highly regulated, highly industry, and there's so many burdens, and it's like, they're nice in theory, right? Everybody wants to positively impact their community, but in reality, we don't have the bandwidth to make sure that and we have no enforcement mechanism within our regulations, right? So I just get confused by,
Shy of not renewing a license.
Right.
yes, if they have one.
Right.
So I just get confused, I just wanted to single that out, that
Director Hearn, if you.
Thank you, Chair.
Take it, Director, sorry.
And to that question, and I viewed these exercises as really an opportunity to not hold up the renewal process and give somebody a path forward, because ultimately this is the opportunity for you to enforce. Right now, to say we're not going to renew you because this is not in line with what we're looking for. So this is a bit of a middle ground to say we're looking for this to be updated and we'll move you forward with the renewal. So I viewed it as a bit of a middle ground to ensure that we are moving folks along, but also that you are doing this through the renewal process. And I think also within the host community municipal equity from Chapter 180 that we've now incorporated into our investigations, that, really there are other instances in which this is coming up. So we are needing to be on top of it as a staff. And so I think the renewal is the mechanism, and the option to say, if you could get back to us on making sure that this is in compliance, but we can move you forward with the renewal is a bit of a middle ground.
If I could just comment, and I'm getting ahead of ourselves, but with Director, we had a conversation yesterday about, we're going to be getting to this later, but I asked the question about the two that might be in jeopardy of not getting renewed, and their EEA. So we could potentially be not renewing the license of our very, very small universe of EEA licensees. And we had a great conversation yesterday, and I really appreciated, the thoughtfulness of Attorney Gooden and Director Koval, and I'm forgetting Roque's last name, but anyway, we had a really good conversation yesterday. And I do think that it's probably timely. One of the things that I think we need to make sure is that we're practical and that we're following the law. And one of the questions that I raised yesterday is, some of these positive impact plans have clear quotas, which I was questioning whether or not it's even legal for us to be enforcing something like that. And so I think that it might be timely, both looking at, Chapter 180, looking at some of our current regs to make sure that we are maintaining our mission to have positive impact in the community, but making sure that we're not making work for you, making sure that we're allowing, businesses to flourish, but also making sure that it's practical and it functions. And so that would be the only comment. I mean, we're going to get to that later on, but Director Koval, go ahead.
I do want to point out, I was just looking, with the help of EC staff, we looked through the regulations. There is an enforcement mechanism within the regulations, 500.450, which says grounds for suspension, revocation, and denial of renewal applications. And one of the clauses is failure to make substantial progress toward the marijuana establishment's submitted diversity plan or positive impact plan. We just have never used this enforcement mechanism to my knowledge, but it appears that it is in the regulations.
Thank you. Go ahead, Commissioner Stebbins.
Thank you, Chair. Excuse me. And I pick up on Commissioner Roy's point. I think where we have found ourselves to date has been asking for clarification. As Director Koval said, I don't think anything has ever risen to the level of denying somebody a license, even though it certainly would be available within our regulations. I guess, one of the two of the concerns that I have is that every licensee addresses this differently. Some are tremendously commendable to fulfilling and placing serious effort both into their diversity plan and their positive impact plans. And then, as we've noted throughout the years, some other folks, I don't want to, a little reluctant to call it mailing it in, but they copy and paste. you know, if we're placing a focus on this, and I appreciate what you've said at the last two public meetings around the social, supporting our social equity applicants and supporting our economic empowerment applicants, and what we can be doing better as a commission to support that mission. We're missing that all of our licensees can play an active role in that as well. Some put into their positive impact plan. I'm going to coach and counsel somebody who else is trying to go the same path that I've just gotten through. So, I agree with Commissioner Roy. The teeth that we have now are pretty dramatic. But I think there's a way to at least try to get all of our licensees to be kind of operating on the same playing field. And I'm also concerned about the commission at some point getting caught in an aha moment of, you renew this person's license, they're giving money to some organization that doesn't exist, or they're trying to count this, and how do you see that as impactful? Again, thinking that that population may be a small pool of our overall licensees, but I think we'd be questioned about whether we're doing our due diligence with respect to reviewing these plans and thinking about the bigger picture.
I absolutely agree, but I think that it's a broader conversation. You like creativity, and these folks are in business to make money, but also help us execute the broader mission of the law. And what I'm trying to figure out is, how do we make sure that if people are giving us positive impact plans that are, I don't know, in terms of if we're asking about quotas, are we going to be in a difficult position there? And so I think that we might want to take a renewed look at what positive impact plans are, how we define it. Again, I know you like creativity. I like, let's give a business clear and reasonable guidelines for what they have to live up to. Let's make sure that they can live up to this, and let's make sure that there is impact. Obviously, there's always the check the box way, which is donating to the Cannabis Fund, but you can't just do that. So what I think is, again, it's not for conversation today, but it's ensuring that we have clear and actionable parameters under which these businesses can work, because I will tell you, creativity costs a lot of money. And while there are some that are very creative and they might be bigger, companies, having briefly worked with a teeny tiny town of Charlemont a long, number of years ago, it was very, very difficult. And as a small, being in a small community and having the multiple mandates from what you had to do under the HCA and what the municipalities were telling you to do and what the commission is looking for you to do. And again, the overall mission, how do we make sure that we're promoting social equity, making sure that the licensees are our partners because they're making money and they should be, giving back to our mission. But I just think it's probably timely to relook at that whole issue of positive impact plans and how we can make it both easy but also enforceable, and make sure that we're doing both. Because if we're not truly enforcing, we're not doing our job. Mm-hmm. So, and short of, and maybe we need a different penalty. I don't know. Maybe we need to be considering that kind of a construct. But when I was looking through the book, and again, we had problem getting the book last night, but when we were looking at, two of the businesses that are in a problematic situation because they have not responded, about the PIPs, they're both EEA. And so I would be concerned that if they, that they could be at risk of being shut down. And that's absolutely the opposite of what we want to do. So anyway, I'll stop, my conversation. I'll hand it over to Commissioner Roy, but I do think that it's timely that we understand both practicality, impact, and how we can make it easier for our staff and also easier for the businesses.
Yeah, and I agree. And right, this is a very highly regulated, highly taxed. Can be very onerous. And if we're adding additional things that are even more onerous, I think we need to re-examine it. To your point about numerical quotas, I see them on every single positive impact plan. The Supreme Court has been consistent on this. It violates the 14th Amendment of the Civil Rights Act. I don't even know if we should be accepting positive impact plans with quotas on them moving forward, to be honest. We all want racial diversity. We all want that, but they're all quotas I see on every single one. So maybe we need to issue guidance around that. And I just have a question. In the due diligence review, do we literally look at the positive impact plan and make sure everything has been achieved, or is Commissioner Stebbins like he's the safety net? Because it sounds like it's up to commissioners to see if they're being adhered to.
So we try to the best of our ability, yes, to compare what was provided to us in terms of evidence and compare it to their goals and their plans and everything that they have in there. Sometimes we send multiple RFIs, and to Commissioner Stebbins' point, they, for whatever reason, do not respond, as we will see later in the public meeting. So we do try to the best of our abilities to literally check progress on every single plan and ensure that it's substantial and the evidence is adequate. But again, sometimes they do not respond
But I think this is also part of the problem with creativity, is that it makes it harder for you to make judgments as to whether or not they're complying. And so, again, creativity is always good, but if there is a way that we can continue to hold licensees accountable to meeting the mission of social equity, but make sure that it's easier for you to track whether or not they're doing it, I think that, again, it's a broader conversation, but, I think that it's worth having. So Commissioner Stebbins, if you have a final comment.
Just one final point, and obviously we have a vote on this condition. I think just for clarification, we're not asking them to set quotas. We're asking them, they set their own goals. We're only requiring them, and I think this gets back to your comment about creativity. We've always, at least I have, we've always encouraged folks, whether they were in Charlemont, whether they're in downtown Boston, like set a plan that's reasonable and you think you can achieve based on where you are. So I hear you on that point.
Mr. Roy?
Yes, and this is not to deliberate today, but I'd like to flag it for another meeting. We need to bring back the recommendations from Donahue about expanding the map, to your point. With 30 communities, they made recommendations based on incarceration rates to expand the map, which would help some of these communities. I mean, correct me if I'm wrong, I think we're open to bringing that back. And if we voted to ratify that, that would help some of these folks if we expanded that map based on collection of data, incarceration rates. So that's another discussion for another day. But, I'm glad we had this discussion. It's really helpful. I think it is. And we need to re-examine positive impact plans because we do want them to for impact. And Director Koval, I believe they're on the license tracker now, right? Aren't these public now? We said we were going to publish the PIP, so the public could look for it add it for impact.
So what I think we did for the guidance on positive impact plan, we suggested that each licensee can publish these on their website if they so choose, because I think after discussions with the legal team, we couldn't require them to. So I'm not sure if licensees are doing that currently, but they have that option to post on their website.
All right, I think that
It was a good conversation.
it was a very good conversation. So with that, I will entertain a motion to approve the renewal of license alternative therapies, Group 2, MRR 206952, accepting the condition of Commissioner Stebbins. Do I hear a motion, Commissioner Stebbins?
So moved.
Do I hear a second, Commissioner?
Second.
Hearing it moved and seconded, I'll call the roll. Chair votes aye. Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Commissioner Stebbins votes aye, and we approve the renewal of license for alternative therapies, Group 2. And moving on to Ocean Breeze Cultivators, Commissioner Stebbins, your condition.
Sure. Thank you, Chair. My proposed condition for Ocean Breeze Cultivators, MRR 207360. Within 30 business days of approval of application for renewal, contact the CCC Licensing Division to provide a response on how charitable donations in higher education teaching opportunities meet the requirements of a diversity plan in accordance with 935 CMR 500 101 C8K, 935 CMR 500 1034B. Again, just a simple explanation. You know, this licensee has identified these two metrics or strategies as part of their diversity plan. I think one may be a better fit for their going back to positive impact plans. And the one I sincerely want to feel is, you know, hear about is how they feel their teaching at a local college fits their diversity plan. So giving them the opportunity to explain why they include these components to their plan, and we can follow up.
Okay, thank you. Are there any questions or comments? Hearing none, I will entertain a motion, Commissioner Stebbins, to approve the renewal of Ocean Breeze Cultivator with your condition.
So moved.
Do I hear a second? Having been moved and seconded, Ocean Breeze Cultivator is approved with the condition. Now, we are at the 12:10 hour, and I don't want to be too, because we will have a little bit. Does anyone have any thoughts about how we're now at?
Do 8, I think. Well, I want to schedule a licensing.
Sure, okay, fine. All right, I just want to make sure that you're
We can look at it.
comfortable. Yeah, okay, that's fine. All right, I'll move on to number 9, staff recommendation on provisional licenses. Go ahead, licensing manager Moriarty. Oh, sorry. Please, thank you. Go ahead.
So commission staff have identified 2 licensees in which conditions were placed at public meeting, and to date, they have not responded to the commission's request. Commission staff recommend review and further decision on the identified licensees who failed to meet their conditional requirements.
Do we have any additional comments on this? So we've just had a fairly robust conversation. And as we discussed in yesterday's meeting, both of these are EEA. So I want to one of the things we said yesterday, and making this very clear, is how do we make sure people get back? And it's my understanding, Director Koval, that you've attempted to email or call and people haven't gotten back.
Correct.
So my suggestion, again, pending the approval of my fellow commissioners, is what is your recommendation? Because obviously I think we need a more robust conversation, because I don't want to take any sort of non-renewal of 2 EEA licensees, but that's kind of all we have to do right now. Yes, is that our only option?
I mean, I would defer to legal for that, and again, enforcement counsel, because we haven't exercised our enforcement regulations before in this manner. So we could either go back similar to what we did in February and reach out again, try to attempt reaching out again to these 2 licensees and see if we can gain a response, or we can have, like you said, a broader conversation with enforcement counsel and the legal team.
Commissioner Roy?
Yeah, and I feel like this conversation is coming full circle to my point of raising it. So 457C is a failure to make progress can, revoke the license. This is why these conditions make me a little uneasy, because now we have we're spotting now 2 EEAs based on conditions. So our options here are just to say, okay, vote on that. Like, I don't understand what we're tasked with right now, what we're doing.
So I don't know if the legal team wants to take this similar to what we did in February, or
if the general counsel could opine.
Thank you, Madam Chair. I think this is a matter of, it's an issue of first impression, obviously, and there's no clear policy that we've developed on this at this point. So I would not be comfortable opining on a new policy here that hasn't been voted on.
Well, I think that we have one option, which is, do we have another option? I mean, this is what I'm saying. You said, is this the first time that we have, for positive impact plans, considered not renewing licenses? Is this the first time? Commissioner Stebbins?
Yeah, if I might. Thank you, Chair. And happy to kind of just offer some input here because I think these were conditions that I attached, excuse me. These are conditions that I attached to these two license applicants. You know, and to quickly summarize my reasons for doing those. One of them, you know, New Dia, who I visited, they're right behind Fenway Park. I did not go there before a ball game or after a ball game, but visited as a commission member. You know, great business, you know, I think is done a lot to support the industry. You know, they had a goal in their diversity plan, and at time of renewal, these have all been renewed, did not really give us an update as to their goal of reaching 75% of their employees from the CCC.
Yeah, that's a quota.
They set the goal. We didn't give them a goal. They set the
No,
goal.
we're enforcing it. Anyway, I.
Not enforcing it, we're
You have
asking.
the floor. I apologize.
No, just asking them to give us an update on their progress. And we have certainly, I think as a commission, have never pinged somebody for not hitting their goals, but, you know, we want them to be forthcoming, want them to be honest. For Green Soul, they also wanted to report on their diversity plan, and the information they provided at their renewal was really about how many people they hired from disproportionately impacted areas, which would fall under your positive impact plan, not your diversity plan.
Right.
So, you know, asking folks, you know, and I'm also not sure whether both of these licensees realize they'd be on our agenda today, but, you know, giving them time to respond, where we have other licensees, it's not just these two, we have other licensees that completely fulfill their obligation to follow up and provide something to licensing as a result of conditions that we, you know, attach to a renewal. I don't think these delinquencies certainly will rise to the level of any type of fine or any type of revocation. But, you know, I do think public notification of, we're still looking for this information. We want you to provide it to us. We want you to be as successful as all the other licensees who meet conditions that we attach to their license. So, you know, I applaud the Division of Licensing to say, just as an update, we have not heard after multiple times of reaching out from these folks. And as I look at the condition I proposed and the condition that was approved, this is just really a very modest, what I would hope would be a quick information request. So
To the GC, do we have the ability to fine if they have not met the?
I'll read it if I may,
Please, thank
Chair. So the section here specifically 935 CMR, we're looking at the 500.450. So it is each of the following in and of itself constitutes full and adequate grounds for suspending or revoking. So no fine. A marijuana establishment's license or denying a renewal application for a marijuana establishment license. Then if you go down subsection 7, there has been a lack of responsible operation of the marijuana establishment as shown by, but not limited to, one of the following. And then subsection C is failure to make substantial progress towards the marijuana establishment submitted diversity plan or positive impact plan. So that would be basically what you'd be looking at. Again, I think at this stage, I don't believe that there's an action on the table necessarily, but to go back where information was requested and essentially say, we need this information, this falls under this section, we have not received that information, I think would be a reasonable next step.
But maintaining the question, do we have the ability to fine them?
Fine is not included. This is suspension, revocation, or non-renewal.
Commissioner Roy?
Are we voting on these licenses today?
Well, it's up for license renewal, but because we're
so
trying
I
to
guess-
enforce the conditions,
yes,
we're
so
trying to enforce your
I
conditions.
guess we have 3 options that I see. Approve, straight up approve, and acknowledge we're not enforcing 500, 450, 7C. Or, I'm just throwing it out, I'm not support revocation, denial, or renewal. or Commissioner Sims could rescind those conditions and then it's clean. So because I read most of the positive impact plans I read, they're not accomplishing everything. The majority of them are not meeting all of the goals. The majority of them are not. So, and these are 2 EEA. So I just think we have to be mindful moving forward. Again, you know, the enforceability that we have not done. Most of them are not meeting them. And, you know, the Supreme Court has been quite clear on numerical quotas. So I think there's other things we can do. Expanding the map is one of them. But so I'm just saying, I think we find ourselves in a unique situation here right now.
And I will just add, I think it's incumbent upon us to do a better job of clarifying this, because it's very easy to put a condition on something and then we're not enforcing it, and we basically have the death penalty when, you know, we've got a misdemeanor here. And so not that this is not an important, because our central mission is not minor, it is major. But I think that it is incumbent upon the commission to do a better job to create clarity. General counsel wanted to raise a point. He might be answering a question, and then I'll go to Commissioner Stebbins.
Thank you, Madam Chair. I actually had a question for Director of Licensing. These 2 matters here, are they up for renewal at this point in time, or are you?
No, so
expired?
they've already been renewed, but the renewal condition placed at the time, we're saying those conditions have not been met. So despite us reaching out, I don't know, at least I think 2 or 3 times, they have not responded.
So in other words, it's not ripe for a vote right now in terms of their license.
Correct. The renewal's already been approved at the time with this condition. We just need to know what happens now if this condition is not met.
Commissioner Stebbins and then Commissioner Roy.
Thank you, Chair. Yeah, I wouldn't anticipate that we would take any action today. I think we've done this previously at a previous meeting. That kind of public awareness of the failure to comply with the condition, I think, prompted the licensees to comply and offer the information that we had requested as a condition of their license renewal. Certainly, if that happens with these 2 licensees. And I think, Chair, to your point, I think it's fair, and I certainly try to do this when I'm offering a condition, like what's my reasoning behind the condition. So it's clear if the licensee is listening in, it's clear for licensing staff if they get any follow-up calls or communications. But again, I come back to, we have a lot of other licensees who comply with meeting the conditions that we may attach to a license, either provisional or renewal. You know, we're just trying to keep everybody consistent, everybody compliant. And it does bother me that there sometimes is a lack of response to our team. We're just trying to make sure that they are fulfilling their obligations.
Thank you. Any Commissioner Roy?
Yeah, I just like a sense of the timeline. Like, when did we renew these and how long have you been seeking additional information, and when are they back up for renewal? Like, where is that in the timeline?
Oh, thank you. Christine has it all ready for me. So for the first one, they were approved and conditions placed on May 8th. And then follow-up emails were sent on June 11th and August 12th. For the second one, they were approved June 12th, and that's when the condition was placed. And then follow-up emails were sent July 11th and August 12th.
Thank you.
Thank you.
GC?
Thank you, Madam Chair. I just want to suggest, so rather than the options that Commissioner Roy had laid out, there's a separate option, given the status of where we are here, that we do not need a vote to renew here today. There could be a motion entertained to give these licensees additional time in which to respond and comply. And you could set, you know, whatever timeline makes sense in relation to their upcoming expiration date, and do it that way. The point about having that death penalty, I think, as you called it, Madam Chair, that is out there, that is in reg, that certainly stands as a vehicle to pursue. But in the intermediate time period here, you can give the licensees additional time in which to respond to the licensing division and hopefully resolve the issue that way.
Commissioner Stebbins?
Thank you, Chair, and thanks to the GC. I mean, for me, I don't, again, reiterate my interest. I don't think we need to offer a motion. I think it's great that licensing brought this to our awareness. Could certainly ask them at an upcoming meeting, have you heard back from these two licensees? Or we have the option of putting it back on the agenda, but the idea is just to raise awareness potentially for these two licensees. So we're still looking for some information, and, you know, please respond to the request that you've got from our licensing division. So
I think that's a common sense. So I think that we can move on. I think that give the licensing team some additional time to reach out. Their phones are probably, you know, buzzing right now, saying, oh, they're talking about you. So maybe you will get a swift response. So with no further comment, we'll move on to number 9, staff recommendations on provisional licenses. And I just want to say, I have 2 different things. I don't know. I'm not sure where some of these conditions are coming.
Don't have any conditions.
You don't have any conditions? Do you have any? Okay, great. Because I'm just a little bit, it's here, but I think it's just an example. So anyway, licensing manager Moriarty, if you can move to Cannabis MCN 283953.
The applicant here is Cannabis LLC. The proposed location is 331 Turner Street, 2nd floor, located in Attleboro. They are seeking a cultivation license. The applicant received general review. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Are there any comments or questions? Hearing none, Commissioner Roy, I'll entertain a motion to approve the provisional license of Cannabis LLC.
So moved.
Do I hear a second? Commissioner Stebbins?
second,
Having moved and seconded, I'll take a call of the roll. Chair O'Brien votes yes. Commissioner Stebbins?
yes,
Commissioner Roy?
Aye.
And unanimously approved. Moving on to Wild Weeds.
Good about.
Oh, I thought I voted. I voted yes.
Oh, I'm sorry.
Yes,
I
that's
apologize.
okay. I'm sorry. I'm talking too fast.
No, you're moving us. That's good.
Okay. Having been unanimously passed for Cannabis provisional license, we'll move on to Wild Weeds.
The applicant here is Wild Weeds Corp. The proposed location is 1 Cabot Street, Suite WW, located in Holyoke. They are seeking a micro business license, and this applicant received expedited review. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Are there any questions or comments from commissioners? Hearing none, I will ask for Commissioner Stebbins to move that we approve the provisional license of Wild Weeds Corporation.
so moved,
I hear a second. Commissioner Roy?
Second.
Having been moved and seconded, I'll take a call of the roll. Chair O'Brien votes yes. Commissioner Stebbins?
yes,
Commissioner Roy?
Aye.
Having been unanimously approved. Moving on to staff recommendations on final licenses. Licensing Manager Moriarty, Tower 3, LLC MP 281783.
So these are also voted on in a batch. There are 2 final license recommendations for the commission's consideration, which include 1 product manufacturer and 1 delivery operator.
Great, thank you. So it includes Tower 3 and Uproot. My error. We're doing this as a group. So anyway, are there any comments or questions? Hearing none, Commissioner Roy, will you move the recommendations on final licenses Tower 3 and Uproot?
So moved.
Do I hear a second? Commissioner Stebbins?
second,
Having been moved and seconded, I will call the roll. Chair O'Brien votes yes. Commissioner Stebbins?
yes,
Commissioner Roy?
Aye.
Unanimously approved. And then we are moving on to vendor training, which we do individually, but we only have 1. So we're looking at online training providers, number RVN 453966.
The applicant here is Online Training Providers LLC, doing business as Cannabis Training University, CTU, Online Cannabis Education, OCE. They are seeking a 2-year certification to provide basic core curriculum training in the Responsible Vendor Training Program. They plan on providing virtual training environments. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Hearing no questions or comments, Commissioner Roy?
Why were they, the RBTs broken in different sections 6 and 7 on the agenda?
This is a new application and the followings are renewals.
Awesome answer. Thank you.
Okay, Commissioner Roy, would you care to move the approval of the responsible vendor training for online training?
So
Do I hear a second? Commissioner Stebbins?
second,
Having been moved in second, call the roll. Chair O'Brien votes yes. Commissioner Stebbins?
yes,
Commissioner Roy?
yes.
Unanimously approved. Now we're looking at renewals. Individually. Okay, so we are looking, Manager Moriarty, we're looking at cannabis trainers, RVR 453160.
The applicant here is Cannabis Trainers. They are seeking to be renewed for an additional 2-year certification to provide basic core curriculum training in the Responsible Vendor Training Program. Since their original certification date, they have provided instruction for 4,160 marijuana establishment and medical marijuana treatment center agents. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the commission's review and vote.
Thank you. Can I ask a question before we move on? And I actually, I've been, one of the issues that I would like to address is making sure that I use the term impact a lot. And having gone through responsible vendor training as someone who wanted to be a cultivator, yet the training was really focused towards retailers. And a lot of what we covered really had nothing to do with what a cultivator would do. Are we in the process of looking at responsible vendor training and determining how appropriate it is across all license classes? When is the last time that we updated the obviously there's a basic curriculum and then there's, more advanced curriculum, but in terms of the basic responsible vendor training, when's the last time we updated that?
So I will have to go back and check in with the director of enforcement training because he's kind of overseeing the RVTs and I can get that information for you.
Because someone also mentioned all the employees at the Cannabis Commission should go through RVT to sort of understand what the licensees are exposed to and ensure that we all understand what it means. So anyway, Commissioner Stevens.
Thank you. And it's a good point to raise, especially as we're doing renewals. Like you, I've gone through 2 of these RVT sessions, and I'll be pretty candid. If I had to do it every year, I'd question whether I wanted to stay in the industry. I don't think I would love to see RVT, and this has nothing to do with the trainers. They're all great trainers.
Oh, no, absolutely.
But you said they're obviously teaching to the curriculum that we give them or ask them to teach to. I would love to see us build out RVT as something that is progressive. It's workforce development. It helps agents move ahead in the field as opposed to here's the same information you got last year, kind of how a bill becomes a law, how the regulations work. I think that's all helpful information to have, but after year 2, I'm looking for something that's going to continue to build out my skills to be successful in the industry. So building off your question.
Yeah, and through the chair, Commissioner, I concur with you. I think having it every year places an unnecessary burden to watch the same content that might not be applicable to your license type. So either we don't have the resources to build out right now. It's aspirational and I would love to do that. I was going to kind of talk about new business not anticipated before we adjourn, but maybe this is the opportunity to request an agenda item for the next meeting. I'd like to start a red tape removal committee. Let's talk about red tape we don't need anymore, right? And this could be involvement with external stakeholders, with staff, but I don't want to deliberate on it because we didn't post it. But I'd like to talk about it at a future meeting, so I don't want to violate non-posting. But you got my wheels spinning. Maybe RVT goes to every other year, or maybe you do it twice and you're done until we are able to build it out. So let's think about some red tape removal. And we'll start. Maybe we start with that. And I definitely agree with you, Commissioner Stevens.
Director Hearn.
Thank you. Just wanted to point out 2 things. I believe the Director of Enforcement Training and other staff, we have a meeting set up with the chair to go through some of these items. So I just wanted to flag that. Obviously going to be working through some of those items. And then also one of the things we touched on the first that we also have coming up in the context of social consumption as well, that the chair and I are going to look to finalize here shortly, would be a working group related to RVT. Obviously RVT in the context of a brand new 3 license types under social consumption is a major component of what we're going to have to look at as well, in addition to looking at the existing RVT training.
Thank you. And one of the things, and I did watch the meeting where you gave me credit for it, but creating the position that Armand is in, that was one of the things that I anticipated was going out and meeting. And I used the model of what Ralph Sacramone at the Alcohol Beverage Control Commission, where they go out and on a monthly basis, they meet with licensees. And frankly, that could be something, that each month we have a different topic that maybe replaces responsible vendor training, and that if you go to one of those meetings during the year, you check the box, but it's an opportunity to not only learn and maybe get updates, but also ask questions. And so, I applaud, what he is doing right now with some of the ITLs, but it had always been my vision to make sure that we did what the ABCC did, and what Mr. Sacramone told me is that I think it was within 5 months of them having their monthly meetings with their, alcohol, licensees across the state, their violations went down by 50%. And so then that allows you to go after the big things that are more important. We also can continue the dialogue, allow them to save money on their legal bills so they don't have to be calling their lawyers and say, what do we do here? So anyway, we've had a long debate, not on the agenda. We're not deciding anything. We're going to get back to cannabis trainers. Did we vote on that? What did we have, we've had the discussion. We have not. If we haven't, I'm going to stick to the law. Do we have a motion to approve cannabis trainers,
Yes.
Vendor training renewal? Commissioner Roy, will you make that motion?
Yes, so
Commissioner Stebbins, will you second that motion?
Second.
Having been moved and seconded, I will call the roll. Chair O'Brien votes yes. Commissioner Stebbins?
Yes.
Commissioner Roy?
yes.
It's approved unanimously. Moving on to medical marijuana 411.
The applicant here is Medical Marijuana 411. They are seeking to be renewed for an additional 2-year certification to provide basic core curriculum training in the Responsible Vendor Training Program. Since their original certification date, they have provided instruction for 256 marijuana establishment and medical marijuana treatment center agents. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the Commission's review and vote.
Thank you very much. Any questions or comments from the commissioners? Hearing none, Commissioner Stebbins, will you move to approve the renewal of medical marijuana 411?
So moved.
Do I hear a second, Commissioner Roy?
Second,
Having been moved and seconded, I will call the roll. Chair O'Brien votes yes. Commissioner Stebbins?
Yes.
Commissioner Roy?
Yes.
Unanimously approved. Moving on to Stoker Consulting.
The applicant here is Stoker Consulting LLC. They are seeking to be renewed for an additional 2-year certification to provide basic core curriculum training in the Responsible Vendor Training Program. Since their original certification date, they have provided instruction for 3,114 marijuana establishment and medical marijuana treatment center agents. Commission staff has reviewed the application for compliance with applicable laws and regulations and are presenting it for the Commission's review and vote.
Thank you very much. Are there any questions or comments from commissioners? Hearing none, Commissioner Roy, I'll entertain a motion to approve the renewal of licensor, vendor training licensee Stoker Consulting.
so moved.
Do I hear a second? Commissioner Stebbins?
Second.
Having been moved and seconded, I'll take a call of the roll. Chair O'Brien votes yes. Commissioner Stebbins?
Yes.
Commissioner Roy?
Yes.
Unanimously approved. I suggest we take lunch now. We'll move to recess and then we will come back with items 13. And I thank you both. And this is a great discussion. Appreciate your thoughtful input and look forward to making things more efficient, easier for you to do, and less expensive for our licensees while we are maintaining the mission to important goals. So anyway, Commissioner Stebbins, I will entertain a motion to recess until, do we want to say 12:05 or 1:05, 1:10, let's say 1:10, but we'll do that.
Moved.
So moved. Do I hear a second?
Second.
Okay, having moved and seconded, call the roll. Commissioner Stebbins?
Yes.
Commissioner Roy, unanimously, we will be back in business at 1:10. Thanks, everybody.
Okay, okay, thank you. Right, I'm not reverbing. Sorry about that. Anyway, we're reconvening after our recess, and we are moving to General Counsel Chattopadhyay regarding a decision for Elevate Cannabis.
Good afternoon. Thank you, Madam Chair. Before you today is the recommended decision in the Elevate Cannabis Inc. matter. Just to give this is a recommendation on discipline. It's a recommendation to revoke the license here. One of the licenses at issue, and to take no action with respect to two provisional licenses that never became final. Just for general education, under our regs, the hearing officer issues a recommended decision. And then once that decision is ripe for review, it goes to the board for discussion and approval. Once it is approved by the board, it becomes a final decision for purposes of 30A, and then is subject to the appellate rights afforded by 30A.
One quick question. Was this delayed at all by the fact that we didn't have a hearings officer for some time, or is this timely?
It is timely. I will note that the recommendation in the decision is to make the revocation retroactive to the date of the enforcement action rather than the date of the final decision. So to the extent that it was any sort of delay, is corrected in the text of the decision.
Okay. Thanks. Sorry, keep going. Sorry about that.
No worries at all. So in any event, so the matter is now before the board for consideration. And like I said, once it is approved by the board, it becomes a final decision for purposes of 30A. And then the appellate rights under 30A will become ripe. So with that, I'll turn it over to the board for any discussion.
Commissioner Stebbins, Commissioner Wood, do you have any questions?
I do. It's more, and I did flag it to your attention.
Yep, just now.
On the hard copy, page 3. It stipulates that on October 31st, 2023, the commission, through its executive director and pursuant to its authority under General Laws 94G, Section 4A6, 11. And then it goes on, it issued an order to show cause. I just want to flag that we, at that time, we had an acting executive director. And so I just, for accuracy, don't know if we need to amend that to reflect that.
Thank you, Commissioner. We will take a look at that, and to the extent that any changes are necessary, we'll make.
Okay.
I don't have any questions. It's a thorough report. I think it is appropriate, and Commissioner Roy.
Yeah, I just have a comment. I just want to thank the I&E team, because reading through this voluminous report, there were many inspections, first responders were called numerous times. There was a lot to this, and I want to thank everybody involved who collected all of the facts for the record. It's important that we have that. Everybody's afforded due diligence. Again, I believe this is kind of a case of first impression and the fact of the expiration of the license, but the hearing officer cited case law to support that. So I want to thank our hearing officer, who has moved on to another opportunity. So I want to thank her for her work on this, and thank the I&E team, who you can see put a lot of time into this around this licensee and the lack of compliance. Thank you.
Can I ask one question? This is just sort of to understand what happens in the event. Is there a mandatory reporting every time a first responder, fire, police are reported? Are licensees mandated to report when the fire department shows up or the police department shows up? Is that?
Yes, if I may, Madam Chair, there is a mandatory reporting requirement in that situation, and that is addressed in the course of this decision here. The answer to your question is yes.
And then when a first responder shows up at a licensee, so how much time do they have to report to the Cannabis Control Commission that a first responder, police, fire, ambulance showed up?
I would have to defer to the Enforcement Council to answer that question. My understanding is 24 hours. But I'm happy to be correct and I don't want to speak off the cuff on that one.
And is that for anything? Like obviously like a false alarm, but anytime someone shows up, they're supposed to make a report.
Am I understanding correct? Yes.
Okay, thank you. All right, do you have any questions or comments, Commissioner Stebbins? Commissioner, I'd like to add again, this is a robust report. I remember, this a number of years ago. So and again, they've done an excellent job putting this in place, and I want to thank them. So without any further conversation, I will entertain a motion, Commissioner Stebbins, to approve the recommended decision of the staff. Do I hear that motion?
Staff or hearing officer?
Or hearing officer, sorry, yep, sorry.
So
Thank you for clarifying. Commissioner Roy, will you second that motion?
Second.
Having been moved and seconded, I will call the roll. Chair votes aye. Commissioner Stebbins?
Yes.
Commissioner Roy?
Aye.
Unanimously approved to the recommended decision of the hearing officer regarding Elevate Cannabis. Moving on to commission discussions and votes. License extensions for host community agreement compliance. Sure, is that you, Executive Director?
Certainly, I think, thank you, Madam Chair. I think we can get into probably a few different staff members depending on the questions that commissioners may ask. I think ultimately what has been provided for your board packet was the last time that this question came to the board. And so ultimately at that time, an extension was granted that extended essentially to 600 days. At this point, we are looking at a licensee at the end of this month that would be bumping up against that 600-day extension. And then from October through February of 26, the number of licensees that may be impacted should they not achieve a compliant HCA would increase rather dramatically over that time period. So ultimately, the question is similar to the one that was posed in February of 25, which we've added for the context of the discussion to sort of determine if the commissioners are interested in re-engaging on a further extension or if there is another path that the commissioners are looking for. So ultimately, we're happy to answer questions, but it is a commissioner discussion and decision, and we're here to support any questions that the commissioners have.
Commissioner Stebbins?
Thank you, Madam Chair. Thanks to the ED. This is interesting conversation for us to be having. I'm frustrated as one commissioner by what I see as a reluctance on behalf of a small number of communities. Again, I don't think we have a good sense of how many communities, but the reluctance of some communities to comply with the changes that 180 required us to effectuate. At the same time, for me, there are some kind of positive signs. There's also our continued interest in perhaps intervening legally in a case that would give some clear definition and finality, I think, to this question. And at the same time, I don't want to force any of our licensees to have to close their doors. I would be interested in entertaining for discussion, an extension of up to 1 year to hopefully give our licensees just some kind of level of confidence. But at the same time, I understand that with, granting an extension, we kind of lose whatever teeth we might have to, kind of compel these communities to comply with the law. I think by extending it, again, giving those communities more time. We've had instances, the one in Great Barrington with the town of Great Barrington, which had been one of those reluctant communities, agreed to a settlement with only three of their licensees, but putting some money back into the pockets of the licensees where it best belongs and where it's compliant with the law. I guess I might have a question with respect to either director or CFAO. Again, an extension requires provisional license fees to be paid. I want to make sure we don't run afoul of any operability or functionality to those requirements kind of going forward if we do offer an extension. But yeah, those are kind of my sentiments, my thoughts.
And to the general counsel, could you discuss or just share with me in terms of, again, having not, I mean, obviously this is an unusual situation, and unfortunately, I wish that the commission had actually leveraged the sort of murky area years ago to actually look at the host community agreements, because I think that there was some question as to whether we could or could not. So now we find ourselves in this this complex situation. But what would it take for us to intervene? And I know that this is something that you've been, can you explain that process to me? What has to happen when we intervene in a lawsuit? Does this require a vote of the board, or is this a decision that you unilaterally make?
Thank you, Madam Chair. So with respect to the last question, I think I can answer that first and say that the board at a recent previous meeting has authorized the GC to move forward and to intervene in matters as appropriate. And then in conjunction with the Attorney General's office, of course, and to report to the board regularly with updates. So that is the current status of the board resolution. With respect to the process for intervention, I can discuss that. Just generally speaking, we do work in conjunction with the Attorney General's office on matters such as this, and have been consulting with them on cases to potentially intervene in. And so those discussions are certainly ongoing. We did, as Commissioner Stebbins mentioned in that Great Barrington matter, we did file a motion to intervene in that case. Unfortunately, the motion was not acted upon by the judge before the parties settled, so we didn't get a judgment on that motion. So we're still looking for other matters in which to intervene so that we can get a judgment on the motion and then be involved in those.
The board did vote to intervene in conjunction with the Attorney General in that case?
Yes.
Correct.
Oh,
Yes.
thank you. Okay, Commissioner Roy?
Yes, thank you. So I agree with Commissioner Stebbins. Obviously, we're coming up against the clock, where a licensee is at an impasse with their host community. And the board does have the ability to grant these extensions. So I am in favor of that. Obviously, we don't want to see people have their life savings, their family's life savings. That we all know the challenges in the cannabis industry with federal illegality and access to banking. And so there's a lot on the line, and we want to do everything we can to give people space and grace to be able to negotiate these in good faith. Some folks are having more challenging of a time. We're grateful to see that many communities have submitted HCA waivers or the model HCA, and we're very grateful and happy to see that. So yesterday, and after meeting with Chief Jones and CIE, we talked about some options, and the executive director and myself worked on motion language yesterday. I dropped it in the chat. To Commissioner Stebbins' point, it would grant up to 365 more days. But CIE also, we talked about what else can we do in along the red tape removal mindset. Maybe, we go to a biennial renewal as opposed to a yearly renewal. That was a CIE had kind of brought that up to me as, let's think about this, right? And I think it would, everybody knows the staff and their bandwidth right now. And I think this would help the industry and the agency, quite frankly, if we had staff look at the feasibility of going to a biennial renewal and come back to us with a recommendation. So two things here. I think it's incumbent upon us to grant, if we all agree, an extension for another 365 days. And let's talk about removing more red tape and go to biennial and think about that. So there's motion language, Chair, for you to consider, and Commissioner Stebbins, which the executive director drafted. We worked together, but that's his final draft.
So we probably want him to read it, but just following up on your point, and I don't know if you, but what would it take? What would it take in terms of us going to biennial renewal? What would that take?
Well, I think we have to post that to deliberate. on that.
but I want to know what the process is. Can I ask what the process is, or is that?
Well, I
deliberation?
think in the motion language, we're gonna ask for the staff to come back to
Oh,
us,
'cause again,
what
I
the
haven't-
process would, it's in the chat.
Oh, all right. Oh, okay.
See the chat up, the bubble up there.
Sorry.
Yeah, so they'll come back to us with what the process would look like.
Oh, again, I haven't seen this yet.
No, but if you hit that.
Yeah,
chat-
no, I will. I would ask the general counsel just to read that motion, because I'm assuming that the public doesn't get to see this chat, and I just,
You're referring to the,
whatever the language is that you have drafted
Is
for us to
dropped in the
approve.
chat.
It's in the chat. I can read it if you'd like.
Yeah, but we haven't seen this before, so.
Yeah.
sure, I can, you want to go ahead?
Thank you, Madam Chair. So it's broken into two motions, given where Commissioner Roy was looking to go. And again, just to avoid serial communications, this is the first time it's being shared. But again, Commissioner Stebbins has shared his thoughts as well on potential extension. So the first one would be moved to delegate to the executive director or delegee. I don't have in here, but would make sense to avoid a single point of failure. So move to delegate to the executive director or delegee the discretion to approve license extensions not to exceed an additional 365 calendar days for the exclusive purpose of HCA or HCA waiver compliance, and in furtherance of and in addition to previous motions regarding extensions for licensees approved at the public meeting held on August 11, 2022, May 23, 2024, and February 25, 2025. And under the authority of Mass General Law, Chapter 10, Section 76J, Mass General Law, Chapter 94G, Section 6A, and Mass General Law, Chapter 94I, Section 7, provided that licensees shall be required to pay a prorated fee to cover the extension, and provided further that the effective date of this motion shall be, we would fill in the blank. So that would be motion number one. The second motion would be to move to direct the executive director or his delegee to investigate, analyze, and report within 60 days the feasibility and potential impact of implementing a biennial renewal application process for marijuana establishments and medical marijuana treatment centers. And to Commissioner Roy's point, that would be simply to bring that back through the chair to a future agenda item.
Thank you. Director Chief Clark, do you have a question or a comment that you might want to?
Sure, thank you. I was asking for some clarification on the previous votes for the extension of the 600 days. My reading of that was not entirely clear as to whether it was 600 days only for HCA or for all extensions historically. And so I want to make sure as we do some of these calculations for you that we have the proper parameters. So.
Commissioner Roy?
A great question, Chief Clark. So my understanding is the August 11, 2022 was the first extension around anything compliance, catch-all for anything compliance. Subsequent extensions were pertaining to HCA compliance. I know Chief Jones had mentioned perhaps doing that catch-all again. So this is, I think, something we need to talk about. That's a very good point. We need to talk about right now because I don't know if this is baked in. This seems to be for the purposes of HCA. So do we want separate motion language or how, you know,
Multifarious motions.
multifarious motions? Yes, no multifarious motions. So that's a great point. CIE did bring it up as well. I did send it in the draft to you, but I didn't see it in the final. So I guess I'd go through the chair, ask the ED.
We'll have to probably amend through this discussion, but I would point out as well that general counsel staff helped, and if there's any addition to that, but obviously how this discussion goes, we can update the motion for the intent of the board.
So ask a quick question. Because this language wasn't posted before the meeting, are we okay?
This is the language that would be within the agenda item.
Okay, so I'm just saying, we didn't have to post, again, I'm still making sure that I'm complying with open meeting law. So we did not have to post this language. Okay, no.
The agenda item is duly posted. This would be
Agenda items.
up to the.
Okay, no, I know the agenda item's posted. I just didn't know if we have any duty or
For
responsibility.
live editing.
Okay, great. Okay, thank you. All right, go ahead, Director. I just was trying to, so we probably should, I would suggest two motions. Unless the council says that we can do this in one, but I don't know if you would prefer two, perhaps two.
I would say two,
Yep.
but I would make a friendly amendment to number one if we want to incorporate come into compliance not limited to HCA, just HCA's. So that's what we need to talk.
Can I just interrupt you? Because could we have Director Cofield come up, because we're getting some comments, and I just want, again, for open meeting purposes, I'm getting some questions, and I just want to make sure they're excellent points that are being made as we're live
Yes,
editing.
it's important.
So if Director Cofield could let me know about her issues or questions or concerns, so we're making sure we're getting this right.
So are you talking about the comment?
Well, I just talked about 480
Yes.
days are for HC.
So I was clarifying my understanding to CTIO's question. So the first 120 days, like Commissioner Roy said, are for any reasons, and then the subsequent motions were for up to 480 days for HCA related reasons only. So that's how we've been using the extensions in.
Commissioner Roy, then Commissioner Stebbins.
Is it, how much of the non-compliance is not HCA related as far as for extensions?
I don't even know if we'd be able to figure that out. I mean, I guess we could, CTO, we could try to work to see if we can pull that sort of data, but some more manual, so I think it might entail like going in one by one to identify.
I guess what I'm trying to get at, we can keep this straight up around HCA's. But they can still apply for the 120 days, right? For other matters.
So the way the language was structured and the way it's been applied is, so let's say I've never used extensions before. My first 120 days that I apply for, regardless whether it's HCA or anything, it's going to take up that chunk of 120 days for any reason. And then after those 120 days, it's strictly HCA related. So to your point, yes, it's possible that, you know, if I use the first 120 days for HCA reasons, then I don't have any other related, like if I want to apply for COGS extension, certificates of good standing. Let's say, you know, I want to apply for an extension because I need extra time to get a certificate of good standing. I wouldn't have the ability to do that because the remaining 480 days are strictly for HCA reasons.
If I may, please, is it helpful that we add some qualifiers that not limited to HCA's, but all compliance matters?
I think that's where CIE, where, you know, I don't want to speak for her, but I believe that's why she probably made that suggestion, because we do see instances where, you know, after they've exhausted a certain number, they need non-HCA related extensions. So I believe that was her intent.
Commissioner Stebbins.
Yeah, no, thank you, Chair. I was trying to get to that answer of what are we still seeing in terms of folks asking for extensions because of non-HCA related issues. You know, I'm looking at our, you know, the May 23rd, 2024, the February 25th, 2025, we're really around HCA's. I'm just trying to, and I think that's kind of what our pressing priority is to help those folks who aren't allowed to, you know, renew because they're not getting a compliant HCA in the door. But
Yes, General Counsel.
Thank you, Madam Chair. To your point, Commissioner Stebbins, I think from my understanding, building on the last two votes to extend these extensions, it was limited for HCA compliance purposes. And my understanding was that the discussion and the thought here was to allow for licensees that are coming up for expiration, like the one that the ED mentioned, due to HCA related issues. They would be the ones that would be able to take advantage of any further extension. Legal does have some concerns about opening up the floodgates to additional general purpose extensions, particularly where the discussion here is really focused on those licensees that are maxing out for their HCA related extensions. It does open up the commission to challenges for on a basis of being arbitrary and capricious, for deciding that anything could fall into a bucket for additional extensions. So there again, the way this was drafted was to address the issue at hand. which is the upcoming expiration of a number of licensees who are timing out due to HCA compliance problems.
Commissioner Roy?
Yes, so, thank you, General Counsel. My discussion with CIE was, it would be appropriate or helpful to them to have, cast a wider net. So perhaps we table that part, maybe vote this exclusive to HCA's, and maybe legal and IED can get together and come back with something you're comfortable with and she's comfortable with that would achieve that. And so maybe that's a discussion for maybe the next meeting or another meeting.
Executive Director?
I'm sorry if
Oh,
I'm happy to explore that.
Yeah, I think that.
And I appreciate that. And Madam Chair, I think that we can certainly do that. And within this, I just want to kind of put it within the context as well. Obviously, we had an update earlier under the normal reporting from the Director of Licensing on where we are with HCA's. It's obviously a complicated issue. We have communities that have compliant HCA's, but also are some of the communities that are also the ones fighting against particular licensees. And so this is a complicated matter. And ultimately, as I see this, my thought, and I would, be interested in the commissioners choosing the length of time here that they feel is appropriate. I think it either no action of extending further on the grounds of the HCA. That is tipping the scales to a certain degree because we are now providing one side of a contract negotiation with leverage. Extending it removes that leverage. And yet again, I understand that it's uncomfortable for the commissioners to continue to have to do this, right? The overall goal of the commission, whether it's the commissioner's staff and certainly, Chapter 180, is that these HCA's are no longer a point of contention between businesses and municipalities. And yet I think, just to kind of high level this, the extension being specific to that removes what we see as some conflicts that are coming up on the calendar at the end of this month. And then we can certainly work with INE as well on potential options outside of just the HCA scope.
Commissioner Roy?
I'd like to make a motion on the first question. I think we should take them separately so they're not multifarious.
Okay.
If you're comfortable with that.
Yes, I am.
Yeah.
Thank you, Chair. I do want to point out one item. I do want to point out one piece of information. On the older manual extensions prior to the vote in 2022, we weren't tracking in the first 120 days. There's not a tracking as to why those were asked for. So from a data perspective, to be able to give you reports as to, or even be able to track which 120 were HCA's and which ones were for other purposes. Okay. Historically, we don't have that data. So that's a challenge in order to enforce it as currently written.
We collect it now, if I'm.
Please, Commissioner.
Yes, as part of the extension application, there is a field that they're expected to put in why they're asking for the extension. But prior, it was not available.
But we're kind of outside that territory now, or
with the language of the
extensions prior.
Well,
I
language,
make sure I'm wrapping my head around.
As I understand the language is,
figure out what it means.
It's 120 days,
right,
for non-HCA. And that's a clarity that's for does it go back in time from the beginning of it all extensions, or is it starting as of August? Good, Olivia.
So
please, thank you, Director.
No problem. This is how we've been treating it. So yes, the delegation 420 days went back as far as August the 11th, 2022. But let's say, I haven't used an extension at all yet. So I would start using it today. So I would start with those 120 days. Because the first 120 days can be used for any reason, now it would be tracked because we have a mass CIP application process where, again, to Paul's point, with CTIO's point, you can enter the reason for the extension request, but anything prior to, I believe, November 2024, when it went live, the application went live in mass CIP, we would have to manually go through the email requests to identify what the extension request was for, essentially.
Commissioner Roy?
Yes, that's helpful. Thank you so much. And that was indicative of a moment in time where newer agency, right? Internal controls weren't we weren't collecting the prorated fees. A lot of things were not where they needed to be, but we've since gotten there, right? So it's, can be proud of that. So right now, the 120 is still available based on this. So that motion language still exists today and it's still available. My question to you, and maybe with legal in licensing and Chief Jones, is that adequate? Do we need to go to 240 days? Like, do we need to give a bigger runway? And that's something to think about because Chief Jones had brought up to me. So they already, this exists. So we're not stripping that away today. That will continue to live and breathe and exist. So whether or not that's enough of a runway, we'll look to you to tell us. Maybe they need 240 days for other matters. So does that make sense?
Yeah, no, I think I think I understand where you're coming from and where CIE's intent was. I think where we're trying to identify right now is the HCA
Yes,
issue
yeah.
because, you know, there are some that are going to expire, you know, as soon as a couple of weeks from now. But yeah, ultimately it would be helpful to also have some that are for any reason. So I don't know, I would defer to legal and ED, like, does it make sense to pull them all into any reason? And then it kind of like a catch-all where it's, you know, use it for HCAs or for whatever other reason, or should it just be HCA specific?
Okay, Commissioner Stebbins?
Sure, thank you. Thank you, Chair. I would agree with Commissioner Roy's point. Let's do the extension for HCA related issues. We know that's the one right in front of us right now, the one facing one of our licensees this very month. Happy to entertain, I think as she was suggesting, you know, kind of coming back and looking at the additional 120 days for the catch-all. Because I do have some concerns about that, so I think we need a little more time on that, but happy to, again, if I'm following Commissioner Roy's suggestions, let's move the 365 days for HCA related beginning today. I think we can fill in that date. And you know, that solves the problem that's right in front of us. And again, it's nobody wants our licensees to have to close down because they're coming up on renewal. And again, a handful of communities are not in compliance with the law.
Okay,
I agree.
any further comments or questions? So who is going to formulate the motion language? Can you formulate?
It's already, I can read
I'm
it
just saying, can you read it so we have it, because you've been going back and forth, so.
on behalf of the chair.
On behalf
I will-
yes,
I will say language. The commissioners move to delegate to the executive director or his delegee the discretion to approve license extensions not to exceed an additional 365 calendar days for the exclusive purpose of HCA or HCA waiver compliance in furtherance of and in addition to previous motions regarding extensions for licensees approved at the public meetings held on August 11th, 2022, May 23rd, 2024. Actually, I have to stop. The August 11th, 2022 was not for HCA compliance,
For any reason, it was,
including HCA compliance.
there wouldn't be talk of HCA back
So
then
that
because
should-
we
that
weren't,
should not be
we
in
did
there.
not have oversight at the time.
Thank you.
If I may. It is included in the aggregate as Edie has mentioned. It also correct that motion did not pertain to HCA extension. So I'm comfortable just
Strike that
taking out
language?
The August.
Okay.
11th date.
Okay, so I'm gonna just back up a little. For the licensees approved at the public meetings held on May 23rd, 2024 and February 25th, 2025, and under the authority of general laws, Chapter 10, Section 76J, General Laws, Chapter 94G, Section 6A, and General Laws, Chapter 94I, Section 7, provided that licensees shall be required to pay a prorated fee to cover the extension, and provided further that the effective date of this motion shall be October 9th, 2025.
I'm gonna nominate you for an honorary JD. I don't know how it's gonna happen, but it needs to happen. So moved. Is that seconded? Having been moved and seconded, I will take a call of the roll. Chair votes aye. Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
It is approved unanimously. Thank you. Thanks for all your work on that.
Would you like me to read the second motion, Madam Chair? On behalf of the chair, I will read the motion language. Commissioners move to direct the executive director or his delegee to investigate, analyze, and report within 60 days the feasibility and potential impact of implementing a biennial renewal application process for marijuana establishments and medical marijuana treatment centers. So moved.
Thank you. Do I hear a second?
I'll second.
Okay, having been moved and seconded, I'll take a call of the roll. Chair O'Brien votes yes. Commissioner Roy?
Yes,
Commissioner Stebbins?
Yes.
Passed unanimously.
that's great.
So we're good.
Great.
We're good.
Teamwork.
Sorry, Lisa, didn't need it. Thanks for sticking around.
Thank you. All right, so we are on to delegations for petitions. Wait a minute. Yes, delegations for petitions to changes of regulations. And this is going to be presented by Executive Director.
Thank you, Madam Chair. This is a follow-up discussion from September 11, 2025. There was discussion of rescinding a former delegation for petitions to changes of regulations to run through the Executive Director's office. I had presented at that time some options for updating the actual process outside of the delegation itself. And so within that, I've worked as well with any feedback that I've had to compile what I think might be a process, whether the delegation is rescinded or not. The motion to rescind the delegation can be added, and I think as long as we have a process within that the commissioners agree with, I can then take that and implement new standard operating procedures. So I'm happy to review the delegation itself. I know we discussed that in September, but ultimately it is for petitions that come generally from licensees, but also really any stakeholders to ask commissioners to consider changes to regulations. Obviously, there's a number of instances in which commissioners are updating the regulations. And so some of them get caught when we do a broader regulatory package. Some of them were ultimately not moved forward. And this is dating back, as we had the video earlier, 8 years. So there's a presentation that was provided by the GC to kind of summarize the 13 petitions over that period of time. I've also provided a more recent petition just to give commissioners kind of a sense of what we're receiving and how this would fit within this process. So unless there's any questions on that, I would review what I have as a suggested update to a process. And then the question of the delegation is certainly up to the chair and the board to discuss, and happy to answer any questions. But I can review the process or proposed process unless there's any questions on that.
Commissioner, do you have any questions or comments before he does that?
I look forward to seeing the proposed process, which I did look at. I did suggest one edit to it, which perhaps we can incorporate in the presentation.
Sure. And I will drop this in the chat so you're looking at it, but obviously for the record and for the public, I will read this as well. So let me just drop it in the chat so that you're looking at it. Okay, so, sorry, there we go. Sticky buttons. Okay, so the proposed process now for when a petition comes in from a licensee or external stakeholders to ask for a change in our regulations. Number one will be to transition with an online form to include all documents and or information required under 500-830 and submitted using a petitions mailbox, which has been created with legal and IT. Number two would be all petitions would be routed to legal for review to ensure petitions are in compliance with 500-830 and existing statute. A petitioner would receive acknowledgement of receipt and reference to the petitions mailbox if petitioner wants to provide additional information or seek updates. And a notice to commissioners on blind carbon copy for open meeting law reasons that the petition was received and is under review. Number three would be any petition found to be compliant by legal with 500-830 and existing statute would be brought to the executive director with an executive summary from legal. The executive director would bring that petition to the chair to consider compliant petitions on a public meeting agenda, at which point petitions are provided to all commissioners as background information in public meeting packet. Fifth, all after public meeting discussion, commissioners may one, return a compliant petition to executive director for additional information or further staff review, two, approve for consideration in future regulatory round, or three, dismiss the petition at the will of the commissioners. And just an overall note, and this is just confirming that this covers Commissioner Roy's point, a tracking document of any ongoing petitions for and where they are within that process would be available to the commissioners at any given point to indicate what is currently filed under review, et cetera.
Thank you, Commissioner Stebbins.
Thank you, Chair. And thanks to the ED for pulling this process together. I was reluctant, or maybe I overlooked. I think we also need to include 501-830 for medical regulation changes. But certainly appreciate the process. I'll make a point about another topic that we talked about, which was, and it's related to this, but this is, I think, to Commissioner Roy's point, this is, the policy-making responsibilities that commissioners have. But I think we had also talked about at some point, again, just for discussion purposes today, coming up with a cadence of when we could get reviews of or overviews of waivers that have been submitted, because those also might be directed towards a policy answer. But at the same time, we know that it's from my review of some waiver petitions that have come through, I think folks were looking to the waiver process as a way to effectively petition for regulatory change as well. So even though I think there's, at least for me, a feeling that the waiver process should still be maintained with staff, I think at some point, periodically, we should get updates as to the nature of those waivers, how they were reviewed, because that could drive us to have further policy and regulatory conversations.
Could you repeat that? Because we, US.
Sorry, go ahead.
I'm sorry, can you repeat that last thought?
Yeah, I'm completely in agreement with this process, completely agree with us kind of taking the delegation from the ED back to the commission. Just reflecting on when we've talked about this in other meetings, the waiver process that also exists, that I think for a time was being used by licensees to kind of effectuate regulatory change. But some of those waivers, and I still believe or still agree that that process should be still within staff responsibility. But I'd love to see some type of cadence where they could talk about the types of waivers that they're seeing, because that might drive us to think about other regulatory changes. I hope that answered the question. That was kind of a long-winded answer again, but
Okay, go ahead. ED.
Thank you, Madam Chair.
Yeah.
That is, I think, good context that Commissioner Stebbins is mentioning. And in the same vein that we had the discussion about petitions, we also updated on a number of waivers that the Enforcement Council tracks. And I think within that discussion, it's one of the, I think, important elements here is a periodic reporting of delegated activities. This is a discussion of potentially removing a delegation and then creating a process that works. On the waiver, there was not necessarily a desire of the commissioners to discuss removing the delegation for the waiver process. And yet, I think within the discussion, it's evident that there is good data within the waiver request that we receive that commissioners should have access to that may help you make decisions on changes to regulations in the future. So for example, if we see X number of waiver requests for a particular regulation, that simple data analysis and presentation to commissioners on a periodic basis, it gives you information that you would then use to make decisions, whereas the actual waiver process is rather onerous and doing it through public meeting does not necessarily make sense. That certainly a periodic reporting of the waivers we're receiving, the subject matter, et cetera, was something that we're looking to do. So there was that initial meeting where the data was presented by Enforcement Council, and then setting up a periodic reporting structure for that, I believe is what Commissioner Stebbins is referring to.
Yeah, I'm comfortable with that because the waiver process is really a one-off, or it's a case-by-case individual licensee where the petition is asking for amending, repealing, and which would affect the entire industry, all the regulations. So I'm okay with the quarterly reports on the waivers. It's the real-time reports on the petitions. People lost faith in the process, the petition process, because ultimately what the petition is asking to amend or a repeal a regulation, and really that lies within this authority of this board. So this is really appropriate. I'm really excited for today to claw back this delegation. And I think we have a good process in place and look forward to, again, red tape removal. So let's start looking at these petitions and see what's viable.
Okay, so how do we word this again, because we don't have something in writing, so you've already read this, so you have read this?
This was what I had provided to commissioners for consideration in advance. This is the actual process. So I believe if the will of the board is to lift the previous delegation and implement this process for how commissioners would like petitions to be received and reviewed, then I think if we take a 5-minute break, I think we can just write the motion to include the lifting of the delegation if that's the will of the board, and reference to this process, which we would then create the SOP around.
Okay.
I've added 501.
And so I will entertain a motion to recess for till 2:15, gives us enough time, plus something to figure
Is that enough time?
out whether air conditioning is working.
Okay.
But is 2:15 enough time?
Perfect.
Okay, all right, do I hear?
So moved.
Is there a second? All those in favor? Aye. In recess until 2:15.
Okay, and we are back. So, would you please, I guess we'll put it both in the chat, but also you can read it. So this is part of the public record. So we don't have to send a public record.
Certainly. So I had, thank you, Madam Chair. I had written and read out the proposed process that would be included in the discussion of whether or not to rescind the delegation. And so I believe that there were just a couple amendments to what I read earlier. One was to include 501 830 after 500 830. So I've done that. And then Commissioner Roy, in addition to the note that I have at the bottom about creating a tracking document of ongoing petitions that will be reviewed by, is available to commissioners, that we would include within that tracking document at a minimum, the petitioner name and subject matter, so that commissioners are always aware of which ones are in and what level of part of the process they're through. So that process, as I read earlier, has been updated slightly, but otherwise stands. And so General Counsel has, within the discussion of the commissioners, put forward a suggested motion that reads, motion to direct the executive director to implement the new regulatory petition review process as outlined in the October 9th, 2025 public meeting, and to rescind the delegation related to petitions granted to the executive director on August 6th, 2020.
Commissioner Roy?
I just have a question on the, which I'm excited to hear about, the petition form. Is that ready to go?
I don't know between the GC and the CTIO how much we want to commit to the form being completed.
I think I'd advise just maybe getting to the vote. And is that pertaining to the vote?
It does in a way, because it's part of the process. It's part of that, the new regulatory review process. So I don't know if we want to put a timeline on the form. It's baked into the process and we're approving the process.
It's ready yet fully, but let me just check.
If I may, Madam Chair, just to clarify as well for folks paying attention at home, I think the question is whether or not we want to say within the motion that the regulatory petition review process is ready to go on October 9th, or if we want to build in a slight period of time to have the form completed. Everything else obviously can move forward.
Yeah, I would request,
Chief, I'm just gonna say,
I would, 30 days.
Okay.
So we do November.
Madam Chair, if I may, I would feel better having that form in place and then we go. So this will be effective 30 days. The form will be up.
Yeah, we can get,
Okay.
I can commit to having the form up in 30 days.
Because I don't want like stragglers coming in. It's, you know what I mean? It's like, just let it be all ready to go with a bow on it. Okay, awesome. Thank you.
okay,
So we changed that to
So perhaps if I can add this.
11/9 or ready.
So if the motion would then read, motion to direct the executive director to implement the new regulatory petition review process as outlined in the October 9, 2025 public meeting within 30 days, and to rescind the delegation relating to petitions granted to the executive director on August 6, 2020.
thank you. Commissioner Stebbins,
So moved.
entertain a motion.
So moved.
Commissioner Roy?
Second,
Having been moved and seconded, I will take a call of the roll. Chair votes aye. Commissioner Stebbins?
Aye.
Commissioner Roy?
aye.
It passes unanimously. Now we're going on to the 8th annual activities report with Maggie and Cole.
There he is.
The Director of Government Affairs and Policy is walking up to the table, Madam Chair.
Where are you talking?
You're all set, Matt, whenever you're ready.